You're good, Mr. Chair.
Good morning. It is 10:01. Today is February. Here we go. It is 10:01. My name is John Belamowicz, chair of the Texas Behavioral Health Executive Council. It is February 17th. Call this meeting to order. You can have the roll, please.
All right, Chair John Belamowicz.
Present.
Chair Bridges.
Present.
Chair Brumley.
Present.
Dr. Cartwright.
Present.
Chair Hallbauer.
Present.
Mr. Hampton.
Present.
Chair Merchant.
Present.
Ms. Pryor.
Present.
And Dr. Taylor.
Here.
All present and accounted for.
Very good. Thank you very much for everybody being here, to members of the public, everybody in the room, and those watching on Zoom. We appreciate your participation. We are going to have invited testimony today. We have Major Sharon Jones from the Texas DPS going to be talking about a handful of things regarding a couple of executive orders from the governor, the directive to the Texas DPS to surge anti-terrorism task force resources, and really about mental health professionals and how we interact with risk assessment, threat assessment. We hear not cliches. They're really important. See something, say something. And I think the thing I think about with that is that what happens when we say something. And I think that's what we're going to hear about today. So I'm going to turn it over to Major Sharon Jones. Thank you for being here.
You're welcome, sir. Thank you for all of you, and thank you for giving me this opportunity. And yes, I am here to speak about the definitely let's do something aspect of the governor's directive. But before I get started, behind me, I have some backup, so to speak. Behind me is Chief Jason Davis. He is the chief of probation, juvenile probation from Kerr County. And then also to my left is one of DPS's psychologists, staff psychologist, Dr. Danuta. And so what I definitely want to discuss with you is targeted violence and what the directives are from the governor's office, and also what Texas DPS, what we're doing to carry out the directive. Now, I have to warn you, I have 15 minutes. So I was given 15 minutes. So some of this is going to be rushed. I am definitely available later for a longer version. But we're going to talk about, again, behavioral threat assessment, threat management. And it is a systematic, fact-based method of investigation and examination for those who are on the pathway to violence, those individuals and persons who are on that pathway moving forward towards violence. Our goal is reduce the risk of targeted violence incidents, multiple agency jurisdiction with our teams, effective and enhanced public awareness, and the potential of these threats, and also the effectiveness of the assessment and intervention and prevention, while also respecting civil liberties and privacies, of course, adhering to laws. Our mission, we have relevant stakeholders working together on our teams. We have these behavioral threat assessment teams, we have them statewide, and we have what we've established as behavioral threat management teams literally throughout Texas. And our goal is to get individuals off the pathway to violence. Again, while addressing the concerns, we recognize that it's very easy at times to just take someone to jail and you put them in jail. But while they're in jail, they still have that ideation of targeted violence. And they're, at some point in time, they're going to be released. So we have to make sure that once that happens while they're released, that we are still managing their care. But also, in addition to that, we do not necessarily want an individual, if we can keep them off that pathway to violence, especially if there's a juvenile, we don't necessarily want them to end up within the juvenile system. So we have procedures for that. This is a model that we use. Personal grievance has ideation, research, and planning. This model is literally what we use to determine if someone is on the pathway to targeted violence, not emotional violence, but literally, are they planning or they're researching targeted violence against Texas or schools, whether it's a business or workplace. On this model that I just showed you, you'll see personal grievance. There's always a personal grievance. There's a recognition, so we just have to recognize it. So I'm going to play this video, just a little bit of it. Here we go. He's moving. Wi-Fi is a bit slow. Hold on. Give me a quick moment here. It switched to a different connection. Let's see what happens. Okay, while it's trying to play, I will just explain to you what you should see. You're going to see a young man, and he is just on social media, just generally talking, discussing about his social life. He doesn't understand why girls do not like him. He doesn't understand why actually no one likes him. He thinks that he has the world at his feet and everyone should like him, especially girls.
I think I've seen this video, and he goes just on and on. And it's just really
Correct.
sad. It's a sad personal narrative.
Correct.
It blames everybody else.
Yes, sir.
Yeah.
So that is, my intention was to show a quick snippet of that one, which would lead into this one. No, ma'am, it's not the same person. So this person has the ideation of he's idolizing Elliot Rogers, who was in the previous video. So I wanted you to show you a snippet of this and then show you this person. This is Texas, by the way.
Will say that, agree with that, if you ask them. And pretty much, I'm just the perfect guy.
There's a
Ever.
couple of inappropriate words in here.
I'm pretty perfect. And, I just think you have to be a real stupid bitch.
Pardon.
I think you have to be a real stupid bitch to not realize that.
You see that the weapon is his hand. So let me give you a little tidbit about this gentleman. He is in Texas. What you're seeing on the screen, these are some of his writings, his ideation. When he was a juvenile, he was actually sentenced to a youth facility for wanting to commit mass murder, homicide, suicide. While he's in this facility, he still has the ideation of homicide, suicide. He's released last year around January when he turns 18. When he turns 18, a couple of months later, a few months later, he goes and he attempts to buy an assault weapon. Thank goodness we knew about it, so we were able to stop him from purchasing the assault rifle based on our relationship with alcohol, tobacco, and firearms. Fast forward, we stopped that process, but we know within our behavior threat assessment team, we know he's not going to stop. So we have him as one of our persons of concern. We are constantly monitoring him. Well, one day he decides he's in this park and he's going around the park. He's in this park forever. And we realized that he's scouting a parade, the parade route, which he lives in front of this parade route. He intentionally chose to live on the parade route. As we executed a warrant, this is what we find within his home. All of these equal to bomb making. In addition to what we found in his home, we found these weapons. So we literally stopped a targeted violence within Texas last year. But this is not just the only occasion. That is one of many. We also have others who write these. This is a person who we arrested because the threat comes in. Oftentimes, we do not have the time frame to put them before. Let's talk about them before board. So we found him. We knew where he was. He gave us 15 minutes to get to him because we're going to deliver a package to him, and that's what he thinks we're going to do. So he gives us 15 minutes. The key about the specific timing was we had 15 minutes before he was going to a state building. This is in the Austin area. He was going to a state building, and that was where our 15 minutes came in. Once we approached him, he had a time clock, so he was counting down to 15 minutes. When he was arrested with handgun, extra ammo, and a mask. This is what we prevented. This is also some of his drawings, his thoughts, his ideation. We discovered this after he was released from the county on his own record, right? So we found this. Now, the person on the left, this is a person who we also thwarted another attack here in Texas where he went to a daycare and tried every single door at that daycare with that gun in his hand. This is him at the property of daycare attempting to get into a daycare to execute his ideation of targeted violence. And on the right, that is simply a student in school who wore this body armor to school to find out how long it was going to take before he was discovered at school. This is the Sutherland Springs shooter. This information, again, there was a lot of mental health issues there as well. The governor's executive order. What he's asked Texas DPS to do is start behavioral threat assessment teams, work with mental health professionals, local agencies, FBI, federal, state, local agencies, have a state strategy. We do have a state strategy, and then have an implementation plan for the state strategy. Our multiple disciplinary teams, we have, again, they're statewide. We have faith-based, community, hospitals. We also have mental health professionals who are on our team, excellent mental health professionals who provide great guidance and direction as needed. These teams, again, they just set up, they're confidential. What happens in those teams stays in those teams. Of course, you cannot know of a planned targeted attack and not do anything about it. I will tell you that we have thwarted throughout Texas, and not just our Texas DPS teams, other teams as well. We have thwarted many of these attacks, including a person who was driving by Rob's Elementary, live streaming what he was going to do next as the next school shooter. Again, the ideation. What you see here is literally someone after the shooting in North Texas, that attack in Allen, Texas, he literally went the next day to purchase all of these. So we have a lot of persons throughout Texas on our behavioral threat assessment teams that we are literally making sure we're keeping them off the pathway to violence. Now, this is where I need your help and support. The governor gave Texas DPS the directive to start these teams. What the directives do not do is tell others you have to participate in these teams. So we can start them, and thank goodness we have a tremendous support system throughout Texas. The problem that we have that comes in a little bit is needing the support of mental health professionals, because oftentimes you will have an area where they're not going to assist. They often, and we respect that, they often use the word, well, it's eminent. Well, it needs to be eminent. Well, in our world and on the pathway to violence, if you have eminent, then eminent means that that person, just like we saw in that picture I showed you, he's already at the school with a gun to commit these targeted violence. It is consistent. We are consistently moving people off of the pathway to violence, juveniles and adults. So what we need, and what I'm here to ask you for, and my backup behind me, is we're asking for we're going to propose a bill, but this is where we need your support. We want to protect you and give you the solitude of knowing that you are protected on the behavioral threat assessment teams. If you give us the information inside of these teams to stop an attack, the next Columbine or the next Robb Elementary, that you are protected within the teams. So the bill proposal is for you, basically, in this BTAM team meeting, you can release that information in that team meeting, but only it stays there. So that's where we need your assistance on, because we have a lot of mental health professionals that there are on our teams, but they literally will not give information, or they will tell you, oh, we can't do it. And then some of them will pull out of the meetings. So it's just very important. We do this on a consistent basis. You've probably never heard of any of these because we keep it confidential, but we do have a lot that we remove off the pathway to violence. This is to show that we are serious about our mission at Texas DPS. We have training, constant training throughout the state to make sure that others are aware, and we are constantly spreading the word. And then we have our annual conference where we offer credit to law enforcement, mental health professionals, continuing education credit, because we want our teams that are throughout the state of Texas, we want those to be well publicized, but also, again, I'm here asking for your support. So do you have any questions for me? I probably went over 50 minutes. I apologize if I did.
No apologies needed. This is a really important topic. And I mean, this is what you're talking about on the psychology board. I was on the psychology board. I was the chair back after Uvalde, and we had a special meeting at the Capitol extension, yes, because the general thesis of the meeting was, we're not going to solve the problem here from the psychology board, but if we can find 5% that we can impact and influence, then we're going to do it. And so what I see here, I'm really grateful for you being here. This is gathering the people and the resources to intervene, to reach in and, change the future and prevent this stuff. So this is really important. Questions from the council?
I do have a quick question. Thank you for coming today. I really appreciate your presentation. I guess my question would be, how do we go about setting these committees up essentially? Like, are they going to be sort of like regions of Texas, like different regions, or like your bigger cities? And, obviously we've got a lot of rural land in Texas as well. So just kind of curious of how the setup and how the process will start.
Yeah, like what's the on-ramp for people?
Yeah. Excellent questions. We've already started. We have started throughout Texas, our different regions. Where we need assistance, oftentimes with mental health support, is in the rural areas, in those areas where it's hard to reach. But we do, as far as Texas DPS, we respond to all threats, all concerns, all matters. So if someone has to drive out 2 hours to assess a person, that's what we'll do. But the teams have started, and we've gotten great traction. We also assist in starting other teams where they're not necessarily DPS led. So if we go to an area and they want to start a team, we've assisted with many teams. So we've either started teams and or joined teams. So we've already started. We just need some additional support. And again, the directives are for Texas DPS to start the teams. The team members that we have, where I showed you before, all of these are voluntary. These people come here, and this is the team in Central Texas area. But everyone that you see in this room, EMS, you have the game warden, the mental health professional, schools, all those persons in that room, they all here voluntary because they all understand the mission, but they do not have to be here.
That seems like something for somebody who's in private practice. It probably seems like a bigger lift to take time out of the office to do something like this. But somebody like a school psychologist, if their school district, would it be possible for like a school district to send their people? Yes,
sir. We especially want schools. So this team meets once a month in the Austin area. There's some teams that will meet via Zoom we understand, especially in the rural area. And then there's some they're just different days or different times. So we literally, we're begging to have the schools on board. In this class, in this group, this classification, we do have some schools, but we don't have them always. So I do understand for the private sector that it's important. Also want you to understand in the private sector, oftentimes when we have persons on the pathway to violence, they're not necessarily managed and kept up with. I will tell you there are some who are just basically paid to go away.
How would this work in terms of like time commitment? So this was a meeting in Austin. You've got this training in Fort Worth. What is a time commitment for somebody? Like, imagine, because we're talking to somebody watching on Zoom that's out in West Texas somewhere. Like, what do we tell them right now? Like, what is the time commitment? What's the pitch to, here's what you're signing up for. Here's what you'll be asked to do later on. What
yes,
is
sir.
that?
So the time commitment is minimal. There are times where if we have an exigent circumstances like we did last week, where we need to have a quick meeting to stop a literal attack, we have specific teams. There are core teams. We will call a meeting, and then whoever can jump on the meeting to assist us, whoever can join that meeting, that they join the meeting. That sometimes it's like maybe 15 minutes. And that is also information that we need to present to a DA's office, because there are times where we have to make the arrest, but then we recommend to the judge, Your Honor, can you please release this person to a mental facility so they can get some better care? So it's not a heavy lift at all. With the Texas DPS teams, we literally do all the work. We just invite you, and we have persons of concerns that are presenting to these teams consistently every meeting that we have, not just the Central Texas team. There are teams that are in West Texas, South Texas, but those persons are presented from other agencies, law enforcement agencies, or sometimes the federal agencies. And so it's just a matter of needing the psychologists and the psychiatrists on these teams to just give us that mental health diagnosis. No one else does that on the team. So there are times where we may not have a psychologist on the team. We may have a mental health officer, but we have to have mental health on these teams. That's the only way it would work, because you guys are the only one who can actually tell us what the diagnosis is. No one else does that.
It's a question for staff in terms of like continuing education credits and whatnot. Can we get, where can we get, I don't want to get too creative, but like what can we do to incentivize participation? This is probably the wrong place for a brainstorm, but like, are there any quick ideas on expanding that?
Well, from one standpoint, the conference that Major Jones referenced, as well as the trainings that they offer, if those are, and it sounds like they are all related to the practice of mental
100%.
health, they qualify for CE credit. So
right now they count, go
right now,
upload it to CE
and
broker.
they'd even count under the 50% rule because they're being put on by a governmental entity.
Okay.
And so as long as they got some sort of email or certificate or something from DPS saying you attended the training, congratulations, that they could submit that as CE.
So they would, there's something that exists within this registration that they would have that?
Yes, sir.
Okay, so for the record, get CE credit for going to these.
Yeah, get signed up. It's March 2nd through 5th.
Yes, sir.
Is that right?
Correct.
Yeah, you need to sign up for that pretty quick. And we're telling you right now that you're going to get CE credit for attending that. So I've already actually looked at it. So yeah, it's certainly qualifies.
I would be interested in seeing what, in terms of, if this is a volunteer thing in terms of continued participation, I would be interested in seeing if there's some sort of ongoing way that we can give credit if you're participating in this beyond just the training sessions. So that's a discussion probably for another day.
Yeah, it's probably one that's going to have to take place at the member board level because they control the member boards control the CE.
Right.
Just by way of example, out of Uvalde, the psychology board created that. It's a CE rule where you get continuing education credit if you supervise somebody under one of those HR,
Right.
HRSA or whatever the federally designated healthcare deserts is. So we did that so that you could do something like that for this, something similar akin to that. But this is going to have to. This is a discussion really for the member board level because they control the CEs. One thing I would ask, Major, do you have like a landing page, a recruitment page where you're recruiting folks?
Yes, sir.
You have a recruitment, because we've got a listserv with about 125,000 people on it. And our folks are pretty good about responding to stuff that we send out on that. Is there something that
I can send it to
you
you,
want to make
sir.
a recruitment pitch?
Yes, sir.
Okay.
Any other questions? Discussion?
Mr. Chair, one thing just from a staff perspective, one of the other things Major Jones mentioned, just want to make sure we get direction from the council. They will be pursuing legislation to essentially enshrine the ability of mental health professionals to share confidential information with these threat assessment teams. Is the council interested in us as staff participating in shaping and
Yeah, that's something we testify on the bill. But yeah, in terms of shaping it and saying, here's how we're ready to assist in that, should the legislature do it, I think it sounds like a really great idea. Yes, I mean.
I agree. I just want to point, I guess, a point of clarification. So it sounds like maybe, I'm not sure which issue you're running into. So it sounds like on these threat assessment teams, you want to get like psychologists or other mental health professionals to be able to screen or do some sort of assessment and actually meet with the individual and come up with some sort of like diagnosis, or maybe even submit paperwork for them to be like involuntarily committed somewhere.
No, ma'am.
Okay.
So so once individuals, if they're in jail, like the county jail, we make the suggestion to like the DA or the judge to have those diagnoses done in jail.
Okay.
What we're needing on the teams themselves, when we meet, it could be for an hour, maybe an hour and a half. What we need is for your assistance in telling us, okay, this person is paranoid schizophrenic. That's not our role, but we need you guys to tell us what you're seeing. For instance, I sat in on an assessment where the person, he called out law enforcement and they came out. And a lot of times they have the ideation and suicide and they have the homicide. So we're sitting in an assessment and one of the psychologists said, oh, wait, rewind. And then his response was that interaction between him and the officer, just general talking, he was trying to coax the officer into doing him harm. Well, he was evaluated, he was released. Well, then he goes and he starts shooting. And so he gets out and he's driving down the road shooting. So these are the instances where if we need someone to be committed or to actually, hey, we need to arrest this person, because the judges sometimes they're like, well, no, we're not seeing it the way that you're seeing it. But oftentimes when we have a full package to deliver to the judge, then we get a lot of support. And DPS, we recognize that. So we also hired a I don't want to use the word consultant, but we do use them as for them to evaluate when we have cases that are high or imminent. And so we use them as well, but they're not sitting on these teams that are statewide. We call them in when it's imminent. So it's only for in those teams to have the discussions. And Dr. Danuta, she's one of our members on the Central Texas team that when we're just going to have a conversation, she's there. Or if we need to have something that's imminent, she's there as well to assist.
I mean, I'll just say from just what I heard, I think that I can see how having a mental health professional on the team would be incredibly helpful, but I can also see how a mental health professional on the team might be reluctant to offer a diagnosis because we can't diagnose somebody that we haven't assessed. And so I could see how that could create some tension. Yes, ma'am. So when a person is being presented, they're presented with all the facts. So if you have a law enforcement agency who comes in to present a case, oftentimes they're coming in with the names of the medication. And so that's what we use the psychologist for, is for them to tell us, well, what does this medication do? What happens when he's not taking it? Another example, we had one that for a year, we knew if we did not monitor him, we knew exactly what was going to happen. And so we were literally monitoring him. We have the psychologist. She's telling us, hey, he just got off his medicine. You guys just reported that. Be prepared. And sure enough, that weekend, the assessment was the Tuesday. That weekend, I think it's the Friday or Saturday, he literally goes out to a public place. He stabs someone, then he runs home. He switches into different clothing, switches vehicle, and then he heads back. He's in a pursuit with a police officer. He gets out, and then he does the suicide by cop. But the psychologist had already told us, hey, guys, his benefits were he has no benefits. Here's what's going to happen if he's not taking his medication. So that's what's needed. But we also want you to feel protected. As you literally what you just said is what we're trying to do. And this is where we need your help to help us write that specific language that you are comfortable with, to know that you are protected. And we also recognize the limitations. We're not asking you to sit and just look at the presentation and then hold you accountable to say, this is what I think. And then he leaves there and he goes out and he commits an attack. Within our teams, we have it to where we're protected. We're making sure that whatever stays in that room, there's no coming back for that. But we want something that you guys are comfortable with knowing that you are protected in the behavioral threat assessment meeting, because it's not just the psychologists. We have law enforcement who they stick to their road. We have emergency medical services who will tell you, oh yes, when I went to take him to the hospital, he's literally talking to himself about committing an attack, and then his other self is answering, yes, you need to do it. What I just gave you is a true example of a actual medical call. So everyone on these behavior threat assessment teams have a role, but we also make sure that we protect everyone and their role. That makes sense. Yes, ma'am. I just want to say I totally applaud this effort. I think it's fantastic. It's amazing. It sounds like you're doing some really good work to protect the great people, the great state of Texas. And so I agree. I feel like my recommendation to the council or to staff would be to figure out some way to craft this to protect licensees who are participating in these teams.
Some sort of safe harbor, essentially, that you're making an assessment and opining without all the information.
Yes, sir.
Yeah, just the best information that you have.
Yes, sir.
To clarify the ask of people, of mental health professionals who are participating, so these are going to be essentially meetings and calls and essentially, here's all the information, help us figure out what the heck we're looking at. Is there ever a situation where you're sending a mental health professional out into the field to do something with somebody? So,
yes, sir. When we get calls at times, and this is where it's important in a rural area. When we get calls at time, we literally, if it comes in, it's targeted violence, well, we will have either, if it's a mental health trained officer who can go out, or there are times where we have community organizations who are mental health professionals who will go with us to these meetings. There oftentimes we're not necessarily going all the time in a uniform or in a marked unit. Sometimes we're going in, like, we let the mental health professional talk. We stand back. We're not denying, or we're not undercover to where we're not saying we're not law enforcement, but we know at some point in time we have to jump into that law enforcement realm. But we also have a mental health professional, and sometimes there are times where we will send them in. Can you talk to the family? Find out what the issues are. Sometimes we're finding out it is traumatic brain injury. Well, then how do you handle that? So yes, we do use, when we can, and as often as we can, we do take mental health professionals with us.
And so that's probably the difference, though. We're probably not taking a licensed professional counselor out of private practice.
Oh,
do
no,
something
sir.
like that. We're taking somebody from one of the local mental health authorities with a cadre of whatever infrastructure is around them in that
Yes,
case.
sir.
Okay.
Yes, sir.
I think it's clear. I think it's probably, hopefully, everybody listening is clear of like what we're not expecting of people who are participating.
No,
in
sir.
it. Any other questions? I applaud you guys for being here, for doing what you're doing. I am appreciative that we got together. This is where, when state agencies work together and talk together and figure out which percentage that we can influence, how we can move the ball. And I'm glad that we're having this conversation. And I hope that I'll be checking back with you to see what kind of participation you get
Yes, sir.
out of our licensee populations, and know that you've always got an audience, and whatever we can do to help,
Okay.
we're here to do it.
Yes, sir.
So thank you so much for being
You're
here.
welcome. Thank you for having me.
You bet.
Major, would you be willing to? You're available to put on these presentations. Say if there's various state associations that represent our folks.
Absolutely. Yes.
Okay, so just kind of a word of encouragement to all the state associations listening out there. She's willing to come present for you on this issue and topic. So it sounds like it may be something, a legislative topic coming up.
Yes, sir.
And
And
that's continuing education, right?
Yes, continuing education. Yes. And then when I do presentation, this is just a snippet of what is presented. So it's tailored to whatever group. You give me 10 minutes, I get it done. Okay, perfect. Thank you.
Major. Thank you, Major Jones.
Thank you.
And to everybody else, thank you for being here. Okay, with that, we're going to go ahead and jump into public comment. I'm going to start with those in the room. Philip Crum. And a reminder for public comment, limit it to 3 minutes per person. And if anybody has stuff on a specific topic, we do have the right to do that later. And if it's not on the agenda, we may not discuss it except to decide whether to place the matter on the agenda of a future meeting. So, Mr. Crum, take it away. Tap the button there. Make sure your light's on.
It's on, it's on now.
I think we got you.
All right.
Yep.
Thank you. I'm Philip Crum, a Joe Citizen co-founder of AMP. Major Jones just did an excellent job outlining the external threat assessments. I'd like to discuss the internal threats we face, but first, I want to begin by praising the BHEC staff and the 4 boards for the work you've done. 6 years ago, this agency and its boards under dishes were in trouble. Mr. Spanks and his polished crew and the 4 boards have it running in world-class fashion, so we thank you for that. We must set our sights on regaining the trust of the public because right now we don't have it. We have an enormous public mental health problem brought about by ideology. Our licensee ranks have not been immune to the mental virus that afflicts so many of our citizens. Licensees are practicing based on social justice filters, not evidence-based practices. That makes them activists, not clinicians, and that's the problem we face. The good news is that socialism is losing. It always loses. But the fight doesn't end with new laws and board regulations. Strict enforcement is the only thing these people understand. The American Society of Plastic Surgeons, the ASPS, and the AMA reversed their positions on gender-affirming care treatment last week, citing a lack of science-based evidence. That means there was no evidence when they originally established their positions. It'll be interesting to see if the ACA and its state branch TCA alter their pro-gender affirming care stance or whether they double down and attempt to defy the state of Texas. The ASPS statement says, plastic surgeons cannot rely on the presence of a prior medical intervention, referral, or letter of support as a proxy for surgical indication. ASPS is warning its members not to rely on mental health providers who specialize in gender, who do assessments prior to as a prerequisite for surgery. 2 weeks ago, a 22-year-old detransitioner won a $2 million civil lawsuit in the very blue state of New York against the surgeon and the psychologist that maimed her for life. The mental health pro was included in the suit and was responsible for 70% of the settlement award. That means if you've been participating in this ghoulish treatment of our kids, you'd better have a good attorney, a healthy liability policy, and a backup career plan, because these kids and their parents are pissed and they're coming for blood. Now, assuming Paxton rules that we are healthcare providers, as current code, our rule books, and legal precedent clearly states we are, that'll plug the last option for the practice of any portion of gender-affirming care in Texas. There will be an element of our licensee base who will refuse to comply, regardless of state law or professional organization recommendations. BHEC and its boards must be ready to enforce code and regulation. The liability exposure alone will demand it. I have no doubt the BHEC leadership will see to it that code is properly represented in the rule books. We just hope that the boards see fit to craft penalties for noncompliance that are commensurate with the crimes, because our kids are counting on us. Given the current events of just this month, we need to be proactively thinking ahead. Thank you for listening to me.
Thank you for being here, and thank you for your comments. Kathleen Mills. Thank you for being here.
Thank you, sir.
Take it away.
Okay. My name is Kathleen Mills. I'm a licensed professional counselor supervisor. I'm a certified employee assistance professional and a co-creator of AMP. Many counselors we know are having trouble filling their calendars and making ends meet, and we've identified several compounding reasons. Number one, inflation has reduced discretionary money for self-pay clients. 2, deductibles are still through the roof. 3, EAPs paying poorly, not keeping up with inflation, or even canceling providers for imaginary future offenses. The 4th, the vertical consolidation of healthcare and the turn to AI and headway-style programs don't pay well. Next, unprofessional online activity by activist licensees, witnessed by public, resulting in, the last, a seismic lack of public trust. Our profession has a massive public relations problem now. Half of our licensees proudly count themselves social justice warriors and are currently being blamed in the media for greenlighting the chemical and surgical mutilation of our children. This problem will get worse as professional associations reverse course on their recommendations, as Philip mentioned earlier. The problem is those of us who believe this behavior is demonic are being lumped in with the offending counselors. That's having a negative financial impact on our practices. Our profession has become the public gatekeeper for the child mutilation industry. So how does Joe Citizen find a counselor who bases their practice on classical evidence-based treatment? There are fractured attempts by counselors to create public databases of non-woke counselors, but informing the public costs money and will remain problematic. There's currently no good way for the public to identify a classically trained therapist from a social justice activist with a mental health license. Second, how do we prevent the very public, very one-sided attack on classically trained counselors? You dare to question gender-affirming care, and you'll face a rash of negative reviews on your Google, Yelp, and other online platforms, as well as threats of bodily harm. These childish one-star postings by licensed adults aren't even clients. Their sole purpose is to drive business away from the targeted counselor's practice, and while that may be prosecutable in a court of law, who has the money to pursue that? Other medical boards have ethic regulations in place to prevent this through the threat of loss of licensure. I'd like to see all 4 boards consider doing the same because this is an ethics issue. This has got to stop, and it won't stop until they're held accountable, and it hurts. A licensee is allowed to believe whatever they want, but they are not allowed to run afoul of the law and the Texas Code of Ethics or intentionally harm another's practice. There must be consequences, or this will never end. Thank you.
Raquel Watson DeShields. Good morning. If you'll just state your name for the record and take it away. You have 3 minutes.
Okay. Yes, so I apologize in advance if this is not a novelty. I am Raquel Watson DeShields. I am an LPCA applicant and have been recently told about missing a single class after, already passing the exam, securing a supervisor, and obviously going through the degree program that I went through. I just, in searching for a class, abnormal behavior to be specific, it's been very difficult to secure a program to follow through that doesn't already have a class that I've already pretty much taken in my graduate program. I didn't know how to present this issue. And I just wanted to exhaust all of my options regarding that. For the programs that might have that class specifically, I don't have the time as I have an expiration for my application for this summer, so July. So it just puts me in a very tough bind. And like I said, I apologize. This is not the space or a novelty concern, but I just, I wanted to exhaust all my options. So yes.
Ma'am, did you, what was your degree title?
Yes. Counseling psychology, a master's of education.
Daryl, is that not on our approved list?
It'd be a counseling related degree, but she's not applying for counseling. You're applying for the LPA.
No,
It will be counseling. The
Okay.
associate LPC.
Oh,
yes.
okay. I'm sorry, LPCA.
it is great for you to come and voice your concerns. And this is not speaking for you, Mr. Chair, but always welcome to come and voice concerns. This isn't the forum to handle,
Right.
I'm the person to talk to you later, and we will elevate. There's a committee of the board that you would bring this to talk about exactly what you want to talk about.
Okay,
Yeah,
great. Just wanted to be pointed in the right direction.
Yeah,
Absolutely.
you're. Thank you for coming. You're going to get pointed in the right direction. And Mr. Roming's right. This is not really the correct context to have that discussion, but I think I can judge by Mr. Roming's comments that you haven't heard the end of it. We'll work with you.
All right.
Awesome.
Thank you so much.
Thank you for being here.
Yes.
Okay, I think that's everybody in the room for public comment. Do we have any Zoom online public comment?
We've got a couple of hands up.
Very good. If you guys and ladies and gentlemen on Zoom will state your name and who you represent for the record, and then 3 minutes will begin.
All right, Ms. Dunn, do you have public comments you want to give?
Yes. So going back to the violence risk assessment, I've sat on a BID or behavioral intervention team off and on for years. So what we do is we've been trained in violence risk assessment, like structured interviews that we're able to do with the person. I've had to do it in session before when I've had like a homicidal client. They come in really handy because in school, we don't really get taught that. All we get taught is like, okay, are you thinking of, killing somebody? Any plans, things like that. These go in more in depth. We're looking at hardened thought processes. They have the means, things like that. So we've also, in our informed consent, I work at a college. We've included like if you mention a threat or a safety issue for the college, we're allowed to like go ahead and break confidentiality. So they're informed of that. We also have the care team as part of our informed consent. so that we can give minimal information if it is going to be helpful or pertinent. Never have I really given a diagnosis in these cases. I've always used the structured interviews because it tells you what interventions are required. And so if it's like hospitalization, what have you, and it tells you the severity. Like, it's this really very risky, this is like an imminent moment here. And it scales down from there. So I've always thought that maybe the board should mandate that, counselors have some training in this. I think it's really important. In my career, I've had to do a few violence risk assessments, and sometimes within my counseling scope, they're in my office, just seeking counseling. So just thought I'd kind of throw that in there.
Thank you. Thank you, Ms. Dunn. Do we have more public comment?
We do.
Perfect.
Mr. Francis, do you have public comment for us?
Yes. Thank you so much. My name is Will Francis. I'm the executive director of the Texas Association of NASW. I also cover Louisiana and Oklahoma, and just wanted to thank Chair Belimowitz. Those boards often allow public comment when it comes to rules and before votes are taken on rules. And I know you've done that in the past, and I would love to see more of that and giving folks the opportunity to speak as rules are raised. A couple of comments that I wanted to raise about the rules in regards to 884.11. In the materials under action items, there's a letter drafted by Laurel Clement and I offering concerns regarding the changes to 884.11 in the informal conferences. We understand that BHAC wants to keep the process as efficient and timely as possible while also highlighting the informal nature of these meetings. We believe that requiring that representatives from the licensing board attend the hearing is vital to the process. They have the opportunity to contribute their expertise and knowledge. They're able to answer questions regarding how the board views disciplinary cases, and they can provide the licensee with a connection to their licensing board. An informal meeting composed solely of BHAC staff, as the current rules are laid out, may not feel as informal, and beyond their technical input indicates the board is involved in and having them board there involves that they're there as part of someone who is there present at every step of the way. We offered language that requires a professional member be in attendance if the complaint involved a client. Otherwise, a public or professional member may attend. Regarding the social work rules, the changes to 781.401 allow for an applicant who is currently in a university that is undergoing the process of CSWE certification to apply for an LBSW or LMSW license. There's just 2 points I'd like to raise. One, what happens if the university fails accreditation? Is there any remedial process for addressing this? Would the person have then practiced in a space where they weren't supposed to? Just a concern. And then the rules do not allow for an LCSW applicant who went to a university under accreditation. And I just worry that potentially someone could apply and their university is still under the process. And that would mean that they could not then apply for the LCSW after they applied for the LMSW. So just wasn't sure about aligning the rules. And then finally, regarding social work rules changes to 781.403, the supervision process, we appreciate that these new rules are good for the public. However, our concern is how Texas State Board of Social Worker Examiner rules would be enforceable by professionals licensed under other boards. Since this essentially covers how a professional who is not a social worker is required to keep records and is required to know about the social work rules in the conduct area, how would they know to go read that area of the social work rules? Is that something BHEC's enforceable? Our recommendation is, should these rules be under the BHEC section of the rules and not the social work section of the rules if they're going to apply to other licensed professionals? Or how is BHEC going to ensure that those folks are reading the social work rules so they know that specific areas apply to them? Thank you for the opportunity to comment today.
Thank you for being here and giving your comments.
Ruben Gomez, did you have public comment for us?
I do. Thank you. My name is Dr. Ruben Gomez. I'm a licensed professional counselor supervisor and the liaison to the Texas Association of Counselor Education and Supervision, to BHEC. And we're submitting a comment on Rule 884.11, concerns regarding exclusion of licensed professional representatives from informal conferences. TASIS has concerns regarding the apparent exclusion of licensed professional representatives from member boards during informal conferences. The absence of these qualified professionals brings concern to the integrity, the fairness, and credibility of the process that directly impacts licensed professional counselors and associates facing complaints and investigations. Licensed professional representatives possess the essential clinical expertise and professional judgment necessary to accurately evaluate issues related to the standards of care, the scope of practice, and ethical responsibilities. Their training and lived professional experience uniquely position them to interpret clinical decision-making with proper context. Excluding these individuals creates a significant gap in the evaluation process and increases the risk of decisions being made without a complete and accurate understanding of counseling practice. The exclusion of licensed professional board representatives compromises the trustworthiness of the informal conference process. Decisions that affect professional licensure and career should be informed by individuals who have direct knowledge of the field. Without their involvement, there's a risk that decisions may unintentionally be made that result in outcomes that do not adequately reflect professional standards or practice reality. TASIS respectfully urges the Council to reconsider the proposed rule to require the active participation of licensed professional representatives on the member boards during informal conferences, and their inclusion is beneficial. It is essential to ensure fair, informed, and professionally sound outcomes. Allowing these representatives to participate will strengthen the integrity of the process, protect the rights of the licensees, and uphold the standards of the counseling profession. Their participation would support respondents while contributing to a more informed, balanced, and adequate resolutions of the complaints. I'll close by saying thank you for your consideration and your continued dedication to upholding the standards, professionalism, and integrity of the counseling field, and thank you for your time.
Thank you, Dr. Gomez. I think we'll get into discussion of that later, and we appreciate your comments.
Dr. Hollingsworth, do you have public comment for us? Dr. Hollingsworth, you with us?
I am. Can you hear me?
Yes, ma'am.
Good morning, Chair, Council members, and staff. I am Dr. Lori Hollingsworth, a licensed professional counselor supervisor. Today, I'm serving in the role of the Texas Counseling Association, TCA liaison to BHEC. TCA wishes to convey our sincere gratitude to the Council and its staff for their steadfast dedication and exemplary service as both professionals and public servants. We are acutely aware of the significant time and effort that both professional and public members devote to their roles on the Council and individual member boards. TCA values the opportunity to participate in public discourse and engage in constructive dialogues as stakeholders concerning the rules and regulations that define our practice as mental health professionals. We would like to acknowledge today and thank Christina DeLuna, the members of the LPC board, and Dr. Jody Elder from the Texas State Board of Marriage and Family Therapists, and Mr. Daryl Spinks for their presentations and engagement with our attendees at the 69th Annual TCA Conference in November. On behalf of TCA, I would like to express our support for the formal petition for rulemaking on informal conferences submitted by Laura Clement and Will Francis. TCA is committed to advocating for the highest standards in mental health care. We believe the proposed changes to the rules governing informal conferences are crucial for ensuring fair and transparent processes. While TCA has previously submitted comments opposing BHEC's proposed rule of 884.11 on informal conferences, we find the petition to be a constructive alternative that addresses our concerns. The proposed rulemaking aims to enhance procedural fairness and clarity, which are vital components of the regulatory framework affecting licensed professionals. We believe that adopting the changes proposed in the petition will improve the integrity and effectiveness of informal conferences, thereby benefiting both practitioners and the clients they serve. These changes are essential for fostering a regulatory environment that supports ethical practice and protects the rights of all parties involved. We urge the Council to give favorable consideration to the petition. TCA stands ready to collaborate and provide any necessary support to facilitate the implementation of these important reforms. Also, thank you for bringing Major Jones today to provide this information on how to address safety concerns of individuals who are demonstrating ideations of target violence. And TCA would like to help promote the trainings. Thank you for your attention and consideration of this important matter. We eagerly anticipate the Council's insightful deliberation and decision-making regarding the petition for rulemaking. And thank you for your concerns of mental health professionals in serving the citizens of Texas. It is greatly appreciated, and we are grateful for your continued commitment to excellence.
Thank you for your comments, Dr. Hollingsworth.
That concludes. No more hands.
Good deal. Thank you to everybody's participation and public comment and keeping it timely. That helps everyone be heard and helps keep us moving. I'm going to move into informational items. Mr. Spinks, do you want to start off with that or somebody else?
We did have one person just raise their hand.
Oh, okay. Okay.
She'd had her hand up earlier.
Okay, well, let's go. Let's do it then.
Ms. Graham, did you have public comments you wanted to give?
Yes, sir. Can you guys hear me?
Yes.
Can.
All right. Thank you guys so much. I don't know what happened. I had my hand raised earlier, but I just noticed it was taken off. So thank you so much. Everyone, my name is Lanika Graham, and I'm an LPSC associate. I actually have 2 public comments wrapped up in one today. While I appreciate the survey sent from Texas Behavioral Health Executive Council, it did not provide guidance for respondents who had multiple supervisors and differing experiences with each supervisor. The structure of the survey appears to assume a single supervisory relationship, which does not accurately reflect the experiences of many associates who worked under more than one supervisor. The lack of instructions for evaluating multiple supervisors may have resulted in incomplete or oversimplified responses that do not fully represent the respondent's supervision history. The survey design limits the ability to differentiate feedback when supervision quality, communication style, and compliance practices varied between supervisors. The absence of separate rating sections for each supervisor restricts meaningful and specific feedback. That's the first one. The second one regards CE Broker. And I know that I don't have the DCEs right now, but I'm on many different platforms and I try to answer different questions because I attend the meetings. So the CE Broker platform used for reporting continuing education does not allow entry of half credit hours under the free version. This limitation with CE Broker creates reporting challenges for licensees who complete courses that award potential credit. The inability to document half credits may result in inaccurate CE credits or require unnecessary workaround for compliance reporting. I just wanted to mention this. Thank you guys for your time and attention to these matters. And I actually look forward to learning more regarding the survey and the proposed rule changes in April. Thank you so much.
Thank you for your comments today, for being here. Glad we got to you. All right, anybody else? Last call. Any hands? Going once, going twice? Okay, moving on. I see that, I'm going to just ask a question. I'm going to put ACO on the spot. You guys are here. Do y'all want to go? We're going to get through informational stuff. Are y'all ready to go to keep things moving? Okay, I don't want to put you on the spot and say go, but if we can get through informational items and then maybe we'll get to you without objection from the council. Okay, let's plan on that. Informational items?
Sure. All right, we'll go quickly here. The first item is going to be 4A. It's going to be our performance measures and calculations for fiscal year 26. Don't have anything to report other than we are meeting exceeding all performance measures. Next item I wanted to highlight is I need y'all. I know y'all have already read it, but just make sure you keep in the back of your mind the enforcement statistics that we provided to you in 4D, because that's going to be important for making your decision later on 884.11 and the petition for rulemaking. I mean, in a nutshell, we've got over 900 pending complaints right now. We're receiving a very large volume of complaints every month, so we're going to have to figure out how to tackle that. So just keep that information in mind. PSYPACT, the one thing I would point out there, you can see in the materials that we provided, we're actually benefiting from PSYPACT to the tune of about 1,100 psychologists from outside of Texas who are delivering services in Texas. So we've got roughly 6,000 licensees ourselves, tack on another 11 to 1,200 that are coming in from out of state. So there's definitely an ROI there for that compact. The next item is going to be 4G. That's a new item that y'all have never seen before. And I wanted to start putting something in the materials so that y'all would understand what we are doing. Like later on, we're going to be talking about kind of a window of rulemaking. If I had just done that without any kind of context, y'all would have looked at me like, what are you talking about? I provided this in here because I wanted y'all to see the major projects that we are working on. Some of them are driven by us. Some of them come from external sources outside. Some of them are driven by us or initiated by us. But I need y'all to understand we have reached a point of maturity now where we are tackling some very big projects. We are being tasked with projects from outside entities. And I want to make sure y'all are aware of that so that whenever you task us for a new objective, hey, this is the bandwidth that your staff have. So it's informational only. You guys can change it, move it if you want to. This is just what we had kind of come up with at the staff level. But there it is for your edification. The last two things I want to talk about under informational are J and K, the president's executive order. We're kind of waiting on Patrick is monitoring this. The feds are actually looking at all the state laws in the country that regulate or attempt to regulate artificial intelligence or the use of it. So I'm waiting to see, is that going to impact the Artificial Advisory Council under DIR, which is the new sandbox program that everybody's heard me talk about in the past. We're waiting to see if the feds have preempted that in some way, shape, or form. So I won't know. I don't know the answer to that yet. We're just waiting on the feds. And then the last thing, this will mean absolutely nothing to those out in TV land, but our folks at DPS can probably share my woes on this. And that is the state is moving away from USAS as its basically go-to accounting system, and they are moving over to CAPPS STARR System, and that'll be early next year. It means nothing to anybody out there in TV land or in the audience, but it means that we're going to have to deal with, there's a lot of, in other words, we're not going to pester Jenny for anything while that is going on, because she is going to be mired neck deep in training and getting that system up and running. The bad part is it's going to happen right in the middle of legislative session, which is about the worst time to launch something, but it is what it is, so we'll just deal with it. But that's just an FYI for you guys there to understand that's coming. You shouldn't feel it if it's done right. Y'all won't feel it. The public won't feel it, but we certainly will. And that's it.
All right.
Unless there's any questions.
I have questions.
Yeah.
Question number one, going back to 4D about the report on enforcement operations, and maybe we'll talk about this later, I'm not sure, but I noted that there were we still have 8 cases from 2023, and I'm just kind of curious, like, what is the holdup? Are they still under investigation? Are they going to SOA? Are they waiting to schedule ISCs?
Let me pull that up. What slide are you looking on, Doc?
Oh, gosh. Well, I didn't actually have it pulled up. I just had a note. Let me go pull it up. There's one of the charts.
The Q2.
Thank you. Yes. Slide 3. Oh, yeah, there's one. I didn't even notice the one from 22. So there's one from 22. There's 8 from 23. So just kind of wondering, like, are they going to SOA? Are they, just...
Slide 3.
I can tell you some of them you'll get to vote on today.
Okay.
So some of them they're all typically in the process of either at SOA or they've already gone through SOA, they're ready for you. So they're definitely on our radar. We like to get those oldest ones out as soon as possible. But I know, like, I'm thumbing through the package of materials right now, and I know there's one 2022 case for you guys to vote on. So I wouldn't know exactly where each of them are. I'd have to go find them. But
that's fine.
But yeah, I mean, they're certainly in the process of trying to get resolved.
Yeah, I figure these are mostly SOA cases.
Yeah, being that old, they've got to be going to SOA. They should have already been through all the other processes.
Okay,
We're just waiting on either a hearing at SOA or a decision from SOA.
And then I would imagine the 24 cases are probably things that could still be waiting for like maybe an ISC.
Could be.
Okay. And
Could
then
be.
25 would probably be things that are still being investigated.
Right.
Okay.
Right.
Thank you.
You bet.
Yeah,
Oh,
so
go ahead.
if we have one on the chart and then one in the packet today, then that's going to go to 0 after today.
Right.
Yeah.
Yeah. So, sorry.
I also had about item 4F, the PSYPACT. Is that our Patrick Hyde, who is the chair?
That is.
I had no idea. Congratulations, Patrick. Okay.
He's been doing a good job.
I'm sure I'm sure he has. Yeah. Okay. And then I also had a question, or not a question, but maybe a comment about 4G. First, I absolutely love that you are kind of giving us a picture of what all you guys are doing. I think that's really helpful. I noted that on one of the like kind of future projects that y'all have is creating like closing your practice guidelines. And you know how much the MFT board loves guidelines. So is that something that the MFT board could take over for y'all? I hate to volunteer us this way, but I don't know.
Well, we really, what I had envisioned, I got the idea of, I had worked on a task force with ASPPB where we drafted something similar to that for psychologists. And then the state bar came out with a set of guidelines for attorneys to close, and I really liked what the state bar had done. So I wanted to, what we did on ASPPB really wasn't at the same level as what the state bar had done, I didn't feel like. And so I kind of wanted to copy what we had done for our folks. Now, I didn't want to do it on a board-by-board level because I don't want to end up with 4 different versions floating out there. Yeah. People take the wrong jurisprudence exam. I don't need them using the wrong set of guidelines for closing their practice down. So I kind of want it standardized.
Well, I'm just saying, you know how much we love to put things together.
Yeah.
So if there is any way that the MFT board can help you with this task or any task on this list, like I'm volunteering us.
Okay.
So,
all right.
Anyways.
I may just take you up on that.
All right.
Thank you.
I think that concludes informational items. All right.
Sure.
We'll go into action items, and I'm going to take these out of order. We're going to go to 5H. Is there anything we want to lay out first before we hear from folks?
Hold on just a second, Mr. Chair. I'm getting to it. Maybe a little bit of background, just briefly on it. This has been kind of a long road. It's the end of a long road. Hopefully, it's not the only stop on this, but it really stems back to the Uvalde days.
Yeah, it starts with a good idea and somebody who just was pushing, and we ran into some walls and found our way through it.
It started in Uvalde. We started looking at, okay, we realized very quickly, I think we had 2 licensees in that county, and we realized very quickly, like, how in the world can we get more boots on the ground is really what it boiled down to. And so we started looking at where are some of the hangups, and there are some programs that we cannot do anything for because the components required for the licensure are statutory in nature. School psychology is one of those areas where a lot of it is left up to the board to determine. And so we realized we had some flexibility. We knew of a program at Texas Tech University, a certificate program that they had. It was kind of the springboard for this idea, but Texas Tech didn't quite take it as far as what we thought it was capable.
Can I come back to something real quick for everyone in TV land and out there? You talked about statutory versus rule. We talk this language every day. Statutory being when we bump our head against the legislature and the things that are written in law, signed by 2 houses of the ledge and signed by the governor. We can't change that. But rulemaking, we can. So I just wanted to clarify it.
And exactly. And so we realized, hey, there's some opportunity for us to actually expand the pathways into the profession and i.e. expand the workforce. That's what you hear all the time is workforce shortage. Schools scream all the time, we don't have enough school psychologists to do this stuff. And we thought, well, okay, we might not be able to fix the entirety of the problem, but like you said earlier, we're going to take ownership over the small percentage of that problem that we can. And so that's where this idea was born from. And it's one of those weird things where, the old Field of Dreams saying, you build it and they will come. We built a rule. Nothing existed yet when we built the rule, but we built it in hopes that some creative individuals out there would see it and go, hey, that's an opportunity for us to expand our program. And that's what we got. We changed the rule that allows for folks who are coming from a non-traditional school psychology background. They are not coming with the traditional degree that you would think of to go into the profession, but they're close enough that if they underwent some pretty rigorous training, that they're safe to turn loose on the public and our children in the school system. So that's what we did. ACU called us one day. I guess it was actually Amanda. She started working on it. I'm going to address you common now. We've been working together long enough, but she called us one day and she said, "Hey, I want to talk to you about this program." And so we just started back and forth. She really started grilling me on what our understanding of the rule would allow and wouldn't allow. And there were some uncomfortable conversations. I'm like, well, I don't know if that's what we meant. She's like, well, that's what you said. And so we went with what we said. And then she introduced us to the ACU folks, and we actually went up and had a meeting with Amanda and the ACU team up in Dr. Cartwright's office. He was kind enough to host us up in Dallas, and we laid it out for some members of the psychology board just to see if they were hearing and seeing the same things we were when we kind of laid out this pilot program, and they were. And so we then took it back to the psychology board, who has blessed it, and now here it sits. And this is the first of its kind. What we're essentially doing through this MOU is we are going to formally recognize, the agency will formally recognize that if you come out of that program, you don't have to worry about whether or not your education and training are going to meet the requirements for licensure. You do. That's what this MOU does. It's a guarantee that you're going to meet the licensure requirements whenever you come in. Now, you still got to go through criminal history and all that fun stuff, but at least it gets you over the question of, will my degree count or not? Because all of a lot of folks get hung up on that. Is they may go a long time in their training and education only to get here and go, nope, that's the wrong degree.
That work. We've talked about this before. As a market guy, I think about in inspiring an 18-year-old to enter this career path. They better know at the end of that road that they've got a pathway to licensure. And if there's any question to that, they might go do something else. We heard about that today in public comment when people get snagged on a class and the chilling effect that has on getting new people into this profession. So we're getting there. And we're going to solve other problems. I mean, we're not done with this, but this is one step. So
I have two questions. Question number one, when it comes to a vote, because I'm an employee of Abilene Christian University, do I need to recuse myself?
I think that is, it would be your prerogative.
Yeah.
Okay.
If you've
Yeah, I don't know that she's necessarily conflicted just because she works at the university.
I don't know why you
She's
would.
Different board. You weren't a part of this. You weren't a part of the licensing of school psychologists. So, but I mean, if you feel uncomfortable, you feel like it.
I feel fine. I just
Are they
going to
cut into your budget?
Is it what?
Are they going to cut into your budget?
Y'all are going to give me a bonus for this, right? Psychology is going to send me some money, anyways. No. Yeah. I feel good. I feel good about it. I just want to make sure.
Yeah, I don't think there's any kind of grounds for a conflict or recusal.
I don't think there
here.
is either. Okay, my second question is, historically we have always told programs like we don't pre-approve any kind of program, right? And so I am curious, like creating this MOU, will this open the door for? Because then I feel like in some ways we're doing something that we've always said we don't do. So will this open the door for us to do this with other programs or in other ways, or?
If you actually look on that, not to suggest you didn't, I'm just saying, if you look back on that spreadsheet that I gave you,
I saw that.
You'll see one of the things, one of my wish list for sometime in the future is for us to move more towards a nursing board model.
Okay.
Where I don't know that we'll ever get there without statutory changes, but we move to a model where we can review a program and go, look, we reviewed it. We know as long as you stick to that and y'all don't change anything in it, your students are going to be qualified for licensure based on your degree in education. So I would like us to eventually move towards that right now. I think we did this. We went this way because it's a pilot program. It's kind of a way to get it off the ground to see if it will work. Mm-hmm. And nobody's going to take that chance of setting up a new type of certificate or degree program without some kind of assurances from us that we will take it. So it's a little different from recognizing an existing degree program where they've been feeding students into us all along. This is the first time this has ever happened.
Okay.
Because it's totally it's an alternative pathway, and so
yeah.
Okay, thank you.
I think it's important to also note that it really does meet all the requirements that are needed, for this respecialization or whatever you want to call it. When you look at it, and actually, if you look in your materials, and it's pretty rigorous, and as well as the practicum and internship, and I'll let the ACU folks speak to it. But we were really impressed by what they offer, and if y'all want to tell us a little bit more about it, just so that the public can see. That would be great. But I just want to reiterate that it really does meet rigorous standards that we vetted hard.
And usually, is 15 minutes good enough? Or
Absolutely.
We try to keep stuff around 15 minutes, but
Sure.
don't want to cut you short.
My name is Amanda Rial. I am the School Psychologist Program Manager with Education Service Center Region 20. And as Daryl kind of foreshadowed, this is a partnership between the Education Service Center and Education Region Service Center 20 and Abilene Christian University. And so I think that's part of kind of that rigorous preparation and pathway that we've created, is taking everything that we as the regional service center hear from school districts as to their shortages and their issues and their barriers to filling positions. And we've integrated that into the program preparation that we have with ACU. I'll let you guys introduce yourselves.
I'm Dr. Rachel Team. I am the Director of School Psychology Programs at ACU. I have been at ACU for 16 years as a residential trainer and 14 years as the program director of our residential program, and then now since January, also our retraining program.
And I'm Casey Westmoreland. I'm the Associate Director for our Retraining and School Psychology Program.
And so in terms of development and preparation, we basically reverse engineered things. We took the licensing rules and said, how do we build the program that fulfills all of these elements? And that's what we have shared in the process and development along the way. That's what you see reflected in the coursework, the practicum, the internship, and the access to supervision through qualified supervisors that we will provide through the Education Service Center. We recognize that a lot of our rural and small, geographically remote districts have access issues because of things just like Daryl mentioned, to school psychologists in an entire county. 42% of our counties have 0 licensees, 0. And so providing that access, we, again, kind of took all of those barriers and tried to build that in. When you're building something, you get the opportunity to integrate what you want to see in it. And so we used that kind of platform to do so. The other thing I'll make mention of, you mentioned the coursework and preparation is there. Got to do the background check. They will absolutely do the background check, but as part of our qualifications for the program, individuals have to have at least 3 years working in schools. So unless they've taken a leave of absence and something happened in between, they should already have fingerprinting and a background check that has cleared them because they are already working with children. That's another part of the premise to this alternative pathway, is that it is for working professionals who are working in schools, working with our students already. So we are genuinely building upon their experiences, their knowledge base in their current profession, and filling those course experiences, those practicum and internship experiences to become eligible for licensure as a school psychologist. So it really creates a higher degree of access for students and professionals coming from backgrounds like educational diagnosticians, speech language pathologists, school counselors, school social workers, individuals who already have a wealth of knowledge that we're able to marry and make even greater, to provide that access in large part to things like mental health needs. We also have behavioral threat assessment models in schools and variety of different aspects that our students will be prepared to participate in.
So Dr. Cartwright mentioned, yes, we have aligned this program specifically with the TSBEP rules and requirements for all the coursework, all of that, but we're also aligned with NASP. So our residential program is accredited by the National Association of School Psychologists. We continue to also use that practice model in our training of for the retraining program. And so, when this came up, I'll backtrack a little bit about doing this. We're in a shortage. Like Amanda mentioned, we have 42% of our counties that don't have school psychologists. We know we need more school psychologists. We've looked at the numbers. There is no way with our retirees and our incoming students that we're going to make progress. So Amanda has done a great job of thinking outside of the box. How can we help address this? How can we get more students, more retrained, whoever, to address this shortage? And so as we talked about it, it was evident that this will happen, that we have the TSBEP rule, we can do that, and so someone's going to come in and do it. And so when she brought this to our Texas Association of School Psychologists, trainers, to me, it said, we need to take this over. We care about what our school psychologists look like. I have lots of alums from the last 16 years that are out in the field. A lot of my friends are school psychologists here in Texas. And I want to make sure that our students are well prepared and go out and make a difference. As school psychologists, don't just check the box and show up and say they're ready to serve a school district. And so we have been extremely intentional on how we've developed the program, and we're not accepting any transfer credits. We're saying, like, this is built because it ensures that we know the minimum level of training that you've experienced. We know that a lot of our students are coming with a good bit of experience in cognitive assessment. However, they're still taking the cognitive assessment class because we want to ensure that they have the level of training we want them to have. And that's across the board with counseling, with behavior intervention, all of those things. And so we really are, we know the eyes of the state are on us, and we are working very hard to rise to that occasion. And we have started in January, and we've had some really cool things come from that. A lot of our interviews, we had students say, there's no one in our county, there's no one in our district, in our co-op that does this. We only have contracted school psychologists. So we want to be the first to come in and provide the continuum of services that a school psychologist can provide to our community. Our parents and our families and these kids need it. And so getting to see that has been really cool.
I just want to speak quickly about the rigor. Our students have just started their 6th week. And if you would ask anyone in our classes right now, they would attest to the rigor, as they are also working professionals. But something that was told to me just this week, one of our students said they are already working in the schools. They're doing a lot of the things that school psychologists do, but not everything. And she said, I had no idea so much I have learned in the past 5 weeks. I had no idea which y'all did. And so their eyes were opened, and they are so excited, and they are learning so much. And although they have a lot of that past learning that they already are coming to the table with, they're already getting a whole extra level of learning that they will take out and serve our students across the state of Texas. So we're just very excited about that.
Are there any questions about the program? Any clarifications we can provide?
Can you refresh us just on like from start to finish, like how long the program takes and just sort of the...
Sure. It's a 2-year program. First year is intensive in coursework and a practicum. The second year is the internship that is consistent with the board rules. So that's a 1,200-hour internship. Depending on, we have cohorts that are starting in January, May, and August. And so depending on the start time is when that internship, it will either be a traditional fall, spring, or depending on cohort, could be a spring, fall kind of split year. The program is a distance education program, so accessible throughout our state. I have a nice little graphic, maybe I can send it over to Daryl, but we are very pleased that our first cohort is a complete distribution of the state. Every corner we've got represented. And so distance education, a blend of both synchronous and asynchronous instruction, office hours outside of the school day or the working day, so we can have support for working professionals. Oh, yes, thank you for reminding me. Dr. Tiemann reminded me we do have a residency component that occurs within the summer of the first year and the second year, in which students come to the campus at ACU in Abilene, and we'll have in-person demonstrations of competencies, assessment skills, counseling skills, as well as an opportunity to meet their cohorts in person. They've already established great bonds virtually, but those in-person opportunities, not only with their peers, but also their instructors and professors, and then pick up materials, those types of things. So those residency weekends are integrated, though it is a primarily distance education program.
Thank you.
Thank you.
Is it Samantha?
Amanda.
Amanda. Okay.
We're close.
Yeah, it's in the alphabet.
All good.
You mentioned a lot of professions that can move into this pathway. Yes. Talk a little bit about what that looks like
Absolutely.
for somebody who's, say, a social worker.
Absolutely. So in consistency with the board rule, it's 469-3DA, from the schools or from the psychology board rules. That is the pathway that has the appropriate degree definition that defines who is eligible to pursue the certificate. And so that is basically a master's degree, experience in a related field, and then completion of coursework and other licensure requirements. So we utilized that same set of kind of minimum qualifications to say you have to have a master's degree in a related field working, and we added to our program a minimum of 3 years working in schools, and then some other things like GPA minimum, those types of elements. And so basically any individual who meets those minimum requirements of related experience, working in schools, and a master's degree is an eligible applicant. We have had a tremendous response of individuals who are very interested in pursuing this pathway. And so we have a pretty rigorous application screening kind of process. But anybody, especially in that first cohort, anyone who was meeting those minimum requirements was an eligible student to apply and be accepted in the program. So for a social worker, if they have that experience in schools, that is the foundation.
And that 3-year piece, that's you added that. That didn't come from the rule.
Correct. We felt that there was a need to ensure that we were kind of seeing this as a higher entry point into the career based on that experience. And so to ensure a minimum threshold of that experience, we identified 3 years as that time frame.
And that doesn't necessarily mean classroom instruction.
Correct.
That's
Correct.
some aspect of
correct
child interaction, I guess.
Absolutely. Yeah. It would be things like when we think about some of the assignments for a maybe traditional student coming straight into a master's degree from undergraduate. Part of their experience is, how do I identify myself at the front office and check into the school? How do I know what the basic special education procedure is for a committee? Those types of things. These are individuals who, in their respective roles, they're navigating schools, they're navigating the interactions, they are consulting with either parents or other educators on a regular basis that provide kind of that foundational entry point that we're seeking.
We're also speaking, and as we're trying to stay within the NASP guidelines, that also is, we need to keep our cohorts small. And so we only have anywhere from 10 to 15 spots in our cohort. And so assuring that we have the most qualified individuals with that 3 years of experience has also helped with that.
Yeah, NASP is our National Association of School Psychologists.
How many applicants did you have?
The first round we had 30. This round we are over 50, and applications are still open.
We have 115 actually open for our next cohort that starts in May.
So hang on. So there's over 100 applied. How many will you accept?
15.
15. Okay. So there's obviously, this is good to know that there's more demand than supply for anyone.
Very high need.
Yeah.
Completely.
That's always my question is like, and Daryl was talking about it earlier, like when we change the rule, it's like, okay, who's ready to step up to the plate? And so that's really gives me a lot of encouragement that there's that many people who want to do this, and highlights the need for a lot more of this.
Well, and lots of our applicants said, I've been waiting for years to be able to do this, 5, 10, et cetera, years. I've wanted to do something like this. I couldn't leave my regular job and go back to graduate school, but this allows me to do what I've always wanted to do. And so that's been really cool to be on this side of it, to see just their excitement to have the opportunity.
My only concern is I understand why it makes sense to have small cohorts and the value of that, but the other part of this, as we're trying to solve a statewide problem, like we've got to figure out how to do it more than 10 at a time.
Yeah, that was kind of my question. How are we hoping that this can grow? Is it applicable to other areas? Can this be a model that can be replicated other places?
You asking how we can apply something like this for the LPC board?
Well, maybe indirectly, but knowing you guys, you've thought through this. Can this? You're not going to do all this work just for a single program.
Right.
Where else can it be applied?
What we wanted to do is test it out on them first, make sure it was going to work. We didn't like crash the plane into the side of a hill or something.
Okay.
Anyway, I don't think that's going to happen. It really depends on what your statutory requirements are, how flexible your statutes allow us to be. For school psych, for LPAs, we have a great deal of flexibility. For marriage and family therapy, they've got us ratcheted down so tight, I'm not sure that there's anything we could do.
Okay.
Psychologists, probably not much we can do there. I'm not sure on social work because y'all have got that CSWE accreditation requirement in there, so I'm not sure what that would do for us.
I'll say this is that, in that meeting we had at Uvalde, one of the things I remember saying is that I'm not afraid to bump my head on statute.
Yeah.
And so if we run into statutory problems, I'm not afraid to go over to the ledge and when asked to say, hey, we've gone as far as we can go. We're hemmed in by the statute. If you think this is good, what we're doing here, this is what hems us in here. So I'm happy to, when we get there.
Yeah, I think we can take a look at it. Honestly, probably the most prime candidate after the psychology field would be counseling.
Yeah.
Because of y'all statute doesn't have quite as much. It's got a little bit more wiggle room, I think. I don't know that you have as much as what psych has for those two fields, but you've got a little more wiggle room than the others do.
Okay.
So we can take a look at it.
Well, and I'll add too, we already have other programs who are wanting to copy us. I've already had several calls of other trainers like, oh, you did this? Can we have a call? Can we talk about it?
Can we copy your homework?
Yeah. So I think it's not long before there's others who are interested in pursuing the same thing as we're doing. Additionally, we would like to, once we have one cohort completely under our belt where we've seen where the hiccups are and all of those things, then add in a second, so 2 cohorts going at a time. So then we're talking about 30 students each time, 3 times a year, 90 students. Right now we're talking about 45 students in a year. So that could, even 45, what is it on top of what we're putting out now across the state is huge. But yes, we think there's capacity to definitely move. And everybody and their dog is pressuring us too, except for NASP. And so, because especially, everybody, the university, the districts, everybody. So we want to meet that. But we've also held firm in that we want to ensure that this is strong and see where the bumps and hills are before we go bigger.
One thing we really have to study, and I'd want to be real careful about on like the counseling side of it, is just y'all sheer numbers.
Right.
If we created something that really boosted the folks coming into the pipeline, we got to worry about it. Can we handle it at the agency level? Can we handle that? Yeah, we can handle that. You guys operate on a whole different scale.
That's why they're blazing the trail for us.
Yeah.
One thing I'd also note is why it works in this situation is that the way the program is structured and the way we are approving it in the MOU is there are 12 specific courses that everyone must take, and that's everybody takes these 12 courses. When we branch out, if we branch out to larger degree programs, the more students have a choose your own adventure ability to pick between 20 courses that may fit a particular academic requirement, that becomes much harder to pre-approve and pre-recognize the program because you won't always guarantee that the student has taken all of the right courses. But there are going to be some university programs where it does fit, where they have said you have to meet these criteria to get out. So that's where it's very clear here, and it's going to be harder to apply more broadly.
I have 2 questions. Oh,
Go
sorry.
ahead. No, please.
First question is, how many other school psychology programs are there in Texas? Like 5 or 20?
Approximately 22.
Oh my
However,
gosh.
the issue is that cohorts are limited in a ratio recommended by our national association that is also the accrediting body for those programs. And so cohorts are generally around 12 students.
Okay, thank you.
Maybe
And then
15.
my second question is, of the students that have entered the program so far, like how many of them are already licensed as LMFTs, LPCs, social workers, or are they all coming from maybe teacher education or?
Most are through teacher education, they have a master's in education.
Okay.
But also we have one speech language pathologist who's a licensed SLP. And
yeah, so the SLP is licensed through the Texas Department of Licensing and Regulation. And then the masters, the vast majority of our students have that master's in education, and they are credentialed with a certificate through the State Board of Education for an educational diagnostician. That is the role that has a significant degree of overlap with school psychology, sans the mental health aspect.
Okay, cool. Yeah, I was just wondering if we were just like taking from one bucket and putting in another bucket and not actually increasing capacity, but it sounds like this really truly is increasing capacity.
Completely. And I'll just add that of the students that we have in the cohort right now, the vast majority of them are in small and rural areas where they are their district special education director and the educational diagnostician. And so they have instances where like their superintendent of the school district is recommending them to participate in this because they see the value of what that access to school psychology and mental health services in their schools will provide to their community. So this, it's not really abstract and theoretical anymore. We are seeing the fruits of trying to provide access to students that would not have had otherwise.
Excellent. Thank you very much.
Thank you.
Okay, so we've talked about a lot of things here. I'm a bottom line guy. So bottom line is real quick for anyone listening out there. What kind of job is one of your applicants who's about to come through the program? Who is this person? What job are they in right now? You talked about it a minute ago, the distance learning aspect, because I actually forgot about that part. I'm like, do I have to go to Abilene? So like, give us the 30-second elevator pitch on who this is for. Also pointing out that this is not changing standards. Y'all built this program to meet the standards. And before I let you answer, I'm just going to come back to Amanda. Like, I remember when we had some of our initial conversations, you really approached it with the idea of why can't we do this? Why not? And so many of the problems that we've solved up here and from the member board levels, we've asked the question, why not? And we've gotten actually a lot of answers why we couldn't do this or that, a lot. And you got some of those too. We went through some, well, we can't do that. We'll have to try it. And we backed out and we didn't know the pathway forward through this. So this marks something that was not a clear pathway from the get-go. Wasn't sure if we could actually do it regulatorily. And here we are. So thank you. Thank you for that. Thank you to ACU. So just bottom line us real quick, who is this for? And take it away.
Absolutely.
Go.
I'll give you our sales pitch or Zoom land. This is a program for working professionals who have a master's degree, working in schools, and have at least 3 years of experience working in those schools. We are seeing candidates who are educational diagnosticians, school counselors, school social workers, speech language pathologists, special education directors. And this program will provide the necessary coursework and experiences, inclusive of practicum and internship, to become eligible for sitting for your exams and applying for your license. And so we will encourage you to visit the ACU website, complete that online application. We'll have a screening process for interviewees, and we will be selecting 15 students, 2-year program, distance education, synchronous and asynchronous instruction, 2 residency visits to Abilene, so you will get to see Abilene, Texas, and yes, an opportunity that we welcome everyone who is interested in. We also have added that if you are not selected for a cohort, that you can roll over your application into a future cohort because we recognize the competitive nature that we have. So please apply now. We've got 2 weeks, 3 weeks until applications close for May.
One other thing is that this program is built only for licensure in Texas. We have everything we have done is to meet the TSBEP requirements, which for school psychologists across the country, school psychologists are licensed differently. So we have built this program only for Texas. So if you're interested in going outside of Texas, we may not meet the qualifications that you need to get licensed outside of Texas. But if you are ready to stay, we are ready to see your application.
The legislature we've had some comments over there. They like to hear, and I tend to agree with them, where we're increasing our Texas numbers where they don't get to just hop the border. So hopefully other states can take notice too.
I didn't have any questions. I just wanted to make a comment real quick on on behalf of the psychology board. You know, we had that meeting back after Uvalde, where we talked heavily about the lack of mental health professionals in Texas and underserved areas. And I just want to commend you guys, because it wasn't just that y'all saw a need and met it. Like, y'all did an outstanding job of fleshing this out. I know we've been having these conversations for a long time, but y'all did just an absolutely outstanding job. And I think that's commendable. And I want that on the record. With that said, Mr. Chair, if you're accepting motions, I'd like to move that we accept the MOU.
Okay. There's a motion. It's been moved and seconded. Is there any further discussion? Hearing none. All those in favor of embarking on this MOU signify by saying aye.
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 For the chair voting aye. All those opposed say no. The ayes have it. Thank you so much for what you guys are doing. I'm looking forward to seeing it when we hit snags. I hope we hear about it, because this is a pilot, and I don't anticipate many of them. But
one quick question: so with the length of the program, when should we be seeing the first cohort, like graduating it or coming
December of 2027.
I would personally, like at the psychology board, I would love to, I guess, meet a couple of the people that come out of it afterwards. I'd love to just hear their feedback on the program. And I know that we'll get some of that info from you guys as well, but I'd love to meet some of the first class.
That would be
sounds like an agenda item for 2027.
Yeah. We have a great group. So
long-term agenda.
Thank you all so much.
Thank you.
Thank you. Bravo. All right. We've been going now for getting close to 2 hours. You want to take 10 minutes? 10 minutes, and we'll be back at actually I have 47 past the hour. Let's just meet at 55. So 5 minutes till noon. We stand at ease. All right, the time is 11:58. Back a couple minutes late on February the 17th. The Texas Behavioral Executive Council will come back to order. We're going to go into Section 5, Action Items 5A, Review and Consideration of Licensing and Disciplinary Recommendations from Member Boards.
The first, Mr. Chair, would you like me to go and go through all the cases?
I'm pulling it up right now, but go for it.
The first case, just going alphabetically, is John Walter Bordage's. That is a case that was remanded back from SOA after a default and remand was issued. This case concerns a psychologist who was arrested for felony criminal mischief. The court later deemed him incompetent to stand trial, and when they did that, there was a competency evaluation panel formed, and they requested that he get an evaluation, then ordered him to do so. He's failed to comply with any of those requests. So then it was sent to SOA, and he failed to appeal. So it's remanded back for the agency. The board looked at this previously, and there's a draft order that was approved by the board to revoke his license based on the finding that he's not competent and failure to cooperate with the competency evaluation orders. The recusals for this case would be Mr. Bridges and Dr. Cartwright. And if he's in attendance, we would allow him a few minutes to speak.
All right.
But my understanding is he has been committed, and he may or may not still be in either jail or a mental institution because of the being found incompetent to stand trial. So
understood. So I guess for the function of going through the process and making sure, if Dr. Bordages is here in attendance on Zoom, I don't see him in the room. If he's in Zoom, use the raise your hand function.
Seeing no one, Mr. Chair.
Okay. Any discussion? Any motions? Yeah.
I'll make a motion to accept. I'm sorry. What's the language here?
Approve the recommended order that's in the packet revoking his license.
I will make a motion to do that, please.
Heard the motion. Is there a second?
Second.
All right, it's been moved and seconded. All those in favor signify by saying. Is there further discussion? First of all, move second. All in favor signify by saying aye.
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 Opposed say no. The ayes have it. Thank you. Moving on.
The next case in the council's materials is a application denial for Jacqueline Copeland. She was an applicant for an LPA. She appealed the denial, and the board staff, the council staff, found out that the application contained a false degree. We reached out to the registrar from the university that she claimed to have graduated from, and they have no record of her ever attending. So this went to SOA. She failed to appear, and it's been remanded back to the board to look at. There is a proposed order not only denying her application, but also assessing an administrative penalty for the submitting false information to the council. Again, we would ask, there's no recusals for this because it's an application denial, but we would allow her an opportunity to speak if she is in attendance. She did not attend the board meeting previously that approved this order.
For going through this process, is if Ms. Copeland is in the audience, please use the raise your hand feature if you would like to address the board or the council.
Seeing no hands, Mr. Chair.
All right.
I'll make a motion that we accept the recommendation in the packet.
To deny.
Second the motion.
Deny. So to deny and fine. It's been moved and seconded. Any further discussion?
I will say just really nice job with staff and Patrick and with the rest of the staff on finding this, because this is a potential harm to public, so just really nice job.
Yeah.
And Gab, I'm really curious, how did y'all discover that it was fraudulent? Did y'all just reach out to the university by happenstance, or?
No.
Okay.
No, this is one where we have to give kudos where it's due to our licensing community. It was a member of the licensees that reached out to us because they recognized the person's name as being on this website that they had seen of fake transcripts, and that's how we were alerted to it.
Wow.
Well, kudos there as well.
Yeah.
It's kind of, sorry, just to add, it kind of goes into the earlier conversation about see something, say something.
Yep. Any further discussion? All right, it's been moved in second. All those in favor of denial and the fine signify by saying aye.
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 Opposed, say no. The ayes have it.
The next case in your packet is Amy Hagan, and this is the 2022 case that I had mentioned previously. The recusals for this will be Mr. Bridges. This again was a case that went to SOA, and it was a default remand back. She failed to appear at the SOA hearing, and generally this was a case concerning an LPA who had a dual relationship with a client. She failed to secure informed consent before providing services to this client. She had inadequate records. She conducted sessions in public, and she failed to timely report a lawsuit brought by that client against her to the council, and has failed to cooperate. I believe there's a failed to cooperate in here as well. Either way, she has not did not show up, and so we were recommending the revocation. This went to the board previously, and they approved the order that would be revoking her license.
All right. If Ms. Hagan is in the audience, please use the raise your hand function if you'd like to address the council.
I see no hands.
All right. Any discussion? Hearing none, any motions?
I'll make a motion to accept the recommendation in the in our packet.
To deny? I'm sorry, to revoke?
Correct.
I'll second.
All right, it's been moved and seconded. Any further discussion? All those in favor signify by saying aye.
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 Any opposed say no. The ayes have it.
The fourth case in your packet is Christopher Jones. It's a licensing denial application from the LMFT board. Mr. Jones lacked the degree and specific coursework for the issuance of an associate license, and this was reviewed by the board. They denied him. Then it was appealed to SOA. It went to a full contested case hearing, which he did attend. The SOA administrative law judge agreed that he lacked the degree and coursework, and issued a PFD recommending the denial of his application. And then this went to the board, and they reviewed a final order denying his application, which was approved, and that is before you for your consideration. He did attend the board meeting previously and did speak, so if he is in attendance, I would like to give him an opportunity.
If Mr. Jones is in the audience, use the raise your hand function of Zoom.
I see no hands.
All right. Any discussion?
Do I need to recuse myself? Do Mr. Hampton and I need to recuse ourselves from this
No,
one?
because this was a licensing application denial, so this wasn't an ISC. You didn't have, all of this was the same information that everybody, that the board fully
Okay.
had.
In that case, I'll make a motion that we accept the recommendation in our packet.
Right.
To deny his license.
It's been moved and seconded. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed,
Aye.
say no. The ayes have it. Thank you.
The fifth case in your packet is Yolanda Pone. This is a social work case. Mr. Brumley, you should recuse from this one. This is a respondent here was put on suspension from the Defense Health Agency and failed to report that to the council, and then failed to cooperate with the council's investigation of this matter. This was sent to SOA, and Ms. Pone did not fail to appear, and so a default remand was issued back. The order in your packet, the social work board previously reviewed and approved, and it's before you to ratify, to approve and hopefully ratify as well, and it is for the revocation of Ms. Pone's license.
All right. Is Ms. Pone in the audience and like to address the council? If so, use the raise your hand function.
I see no hands.
All right. Any discussion? Any motions?
Make the motion to accept the proposal to revoke.
I'll second that.
Moved in second. All those in favor signify by saying aye.
Aye.
Opposed, say
Aye.
The ayes have it. Thank you.
The sixth and last case in your packet is an LPC case regarding Criselda Santos. Chair Halbari, you should recuse for this case. In this case, the respondent attempted to coerce a supervisee LPC associate to sign off on another counselor session notes that associate never examined. She also demanded the associate divulge private medical information that was not relevant to her employment, and she also failed to cooperate with the council's investigation into the complaint. She failed to appear at the SOA hearing, and so a default remand was issued back. The board reviewed and approved the order that's in your packet to revoke her license. I do not believe she appeared at the board meeting, but again, we should give her an opportunity if she is here to speak.
All right. If Ms. Santos is in the audience and would like to address the council, please use the raise your hand function.
I see no hands.
All right. Any discussion? Any motions?
I do have a question. So, as far as it sounds like 254 counseling sessions for 65 different clients, and the supervisees that were also involved. Was there any with like, I mean, obviously they were also signing notes and along with the supervisor who was having them do that. But are they involved? Were they involved, or was there any? Or is it just kind of stop at the buck stops at the supervisor in this case? Like,
I believe they were instructed to sign them. I don't have any evidence that they did in fact sign them, but she was trying to get other people to sign off of them. I don't have all the information necessarily to answer like fully your question, because what happened with those notes and who signed off on them. But I know that in this particular instance, they were going out. This complaint was focused on the supervisor who was failing to have those notes properly completed, or those records completed.
and essentially, it's kind of a fraud case as well, so just
Right.
Who reported this?
Oh, I don't recall that off the top of my head.
That's
I'm
fine.
sorry.
No worries.
All right. Any motions or questions?
Yeah, Mr. Chair, I'd like to move to uphold.
Second.
All right. It's been moved in second to accept this draft order of revocation. Any further discussion? All those in favor signify by saying aye.
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 Opposed, say no. The ayes have it. Thank you.
Can I ask just a general question? It seems like we heard, I don't know now if there's 5 or 6 cases, and of them only I think one actually showed up at SOA. So it seems like people are appealing, but then taking no further steps to actually appeal, which just seems like a waste of our resources because this drags things out. It takes time. It takes money.
Correct.
Yep.
Is there anything we can? I guess there's probably nothing we can do about that.
It's their right and due process.
Actually, Mr. Romeg and Mr. Hyatt had an idea, and I'm going to let them tell you about it.
So in terms of license denials, no, there's not much we can do if they ask to deny and then they don't follow through with it. We generally have to go. But I suppose we could do denials in the default docket. Anyway, we have reached out and had a very productive conversation with SOA, and are going to start doing what a few other agencies, really much larger agencies, do, which is for ones where we suspect, based on the individual not communicating with us, not responding, not having an attorney, if we suspect they will be defaults, we will set those on a special default docket that can be set earlier and faster, and where no one essentially prepares anything. That's one of the big costs for us is our attorneys have been preparing to go to trial and have a full-blown hearing, and then it never happens. And so we're going to try having a default docket, but to be clear, and for everybody listening, we really do care about due process. If the folks do appear, then it will be reset later for a full hearing. We are not going to ramrod anything through. But if, as we suspect, they don't appear, nobody has wasted time and effort.
Okay, thank you.
Point is, if they've no called, no showed for everything, odds are, and you guys do this, you could predict, yeah, they ain't coming today, with probably a pretty good odds. That makes sense.
The best predictor of future behavior is past behavior.
That's right.
Yeah, I think one of the issues that you'll see in dragging cases out and why some of them are taking so long is the failure to cooperate or the failure to participate. And so when those respondents do, those cases obviously move a lot faster. But as you see, when you're looking at the old cases in the data, the oldest one we just got rid of, now there's no more 22s, but that was one where somebody was just either stringing us along or just not cooperating or participating. And so those make it much more longer. But this also raises another point, which I think we'll be talking about too in some of the rule changes, which are, you're talking about due process, and that is in fact the due process that we're required to give them before we can revoke their license. Even if they don't participate, we have to then give them the notice and then the opportunity. Then they have the opportunity to go to SOA. Then it has to come back to the agency to issue the final order. So there's multiple levels where they're given numerous notices of you can appear, you can state your case, you can present yourself. So that's unfortunately the Administrative Procedures Act is how it's laid it out. And so
this has been upheld.
Yeah.
But I'm sure another agency that does this has been challenged following when we have a rocket docket for a default, and then it got challenged and the default was upheld.
I'm sure it was.
Okay.
Yeah. I mean, it's the likes of TxDOT and TCEQ. So they're doing lots of these and are bigger, weightier in some ways issues. So yeah, it's a pretty standard process.
We are now moving. This goes back to the maturation of the agency. We are now moving in from being small boards to y'all are now 95,000+ probably in the ranks.
Be 100,000 before you know it.
Yeah, I mean, there's a good chance we're going to be over 100,000 by the time the session gavels in.
Thank goodness.
So we're having to think differently now. What worked in the past is not working now, and so we're going to have to think outside the box.
Thank you.
Okay. All right, so that concludes the disciplinary recommendations, correct? I missed something. Okay. Update on the implementation of online CE management system for licensees. Just got that.
Just the short version of it is the system is now live. Everybody that is, you're now required to have and use a CE broker account. Effective January 1st, that went live. So if you're renewing your license, you've got to have the account. You need to be uploading your materials into CE Broker prior to renewal, so that when your renewal date comes around or you try to renew your license on our end, it's going to ping the CE Broker system and give a thumbs up or a thumbs down. Honestly, we have not gotten I don't think we've gotten a lot of problem reports or anything. There's some here and there. Yes, there are going to be some growing pains, but there has not been a watershed or a large swath of problems coming our way that are being reported to us about operations. I know we heard something in public comment this morning about it will not accept a half hour. That's actually not correct. It will accept half-hour increments. I suspect probably what's happening there is they're trying to claim an hour and a half for something that you only get 1 hour of credit for, like the human trafficking, and it's not taking that additional half-hour credit there. So out there, all of you there's only 2 of us here in the audience, but there's out of all of you out there in TV land, it will accept half-hour increments. CE Broker will. So I just want to make sure that's cleared up. Robert, anything else?
Just to give you because I imagine one of the questions is going to be about notice that we're providing to folks and how are they aware, and so just to make sure everybody's up to speed, when somebody is up for renewal, when their renewal application opens, which is 90 days before they're required to renew, or 90 or 60, I think it's 90. At that moment, they will get an email from me saying you're up for renewal, you need to get your documents in order, and here's the date by which your license will go delinquent. They also get a postcard in the mail with that same information. CE Broker will start sending them essentially monthly emails at that point saying either you have not created your account and you need to, or if you have created your account, if they don't have all the required CE reported, you need to get all your CE reported before your license date. We are also, for at least the next several months, I will get a report from CE Broker at the first of the month of everybody who's due to renew that month who does not have a CE Broker account yet and somehow has not registered. They will get another email from me specifically saying, by the end of the month, you have to have a CE Broker account and report. So they will continue to get notices from us and from CE Broker right up until they fail to renew and are delinquent. When they try to renew, they will get a notice saying you don't have CE Broker complete. You cannot finish your application. They will get an email saying your application was not submitted or was not approved. You've got to go fix it. If they still don't and they go delinquent, the day they go delinquent, they will get an email from me saying your license is now delinquent. Fix the problem. So there will be lots of notices going out.
So that's good for the future sob stories I know we're going to hear.
Yes.
Yeah.
That's why we're pouring so much effort into this, so that when we hear, well, I didn't know.
I am curious, what's the scale of the numbers of people who are don't have a CE Broker account at the beginning of the month?
That's a good question. I have that right here. We now have about 28,000 of our licensees with an account as of February 1st. That's about 32% since we started. And that tracks across all the boards. Everybody's right at about 30, 31, 32%. In terms of
Does it look like folks are waiting until the last minute? Is that what you're seeing?
Yes. And that's specifically for, so we are at about 30% of folks total have their accounts. For February, the folks who were coming up and needing to, that was closer to 50%.
So that's some take up.
Yeah.
A little bit of improvement.
I can actually.
What's the next ping that you'll get?
I'm doing a little spreadsheet math. Yeah, it was 56% had an account.
With 30 days to go.
Oh, I'm sorry. That's 56 didn't have an account. So it was the actual.
Okay, 56 did not have an account with 30 days to go.
30 days to go. Exactly.
What's the next trigger you're going to get?
I'll get March.
No, I mean, but you'll get another report of those who go delinquent?
Yes.
How many are going, last month, how many went delinquent because they didn't have a CE Broker account?
I don't want to hang my hat on last month's data because it was roughly 100, I think 150, but there There was a particular issue with the payment process as we were implementing this.
Okay.
That was a unique month, and we had to fix that, and we did. And those folks got personalized emails like, "Here's what happened. Here's how to fix it."
Yeah.
No, it was on our end. We just it wasn't
that was
CE
unrelated
broker.
to CE broker. That's the state has adopted a new payment portal, and I'll just say it hasn't been the smoothest transition.
But that's out of our control.
But that's out of our control.
Well, it was how databases go. There was a switch that wasn't flipped, and
Okay.
we flipped it. It's fine.
Okay. So it sounds though from going from 50 some odd percent to like 100 and some under 200, even with a problem, like we're not having massive problems of the take up at the last minute. Okay, cool. No further questions. Moving on to 5C, update on efforts designing a Texas owned psychology licensing exam.
Mr. Romig is going to handle this one.
Yep.
So we are continuing to proceed. We have gone through. We've conducted a national survey. We have conducted various working groups with stakeholders across the country, particularly focused on the academic community who are training psychologists, developing recommendations for what a psychology exam could look like. We are now engaging with a technical advisory committee who are folks steeped in psychometrics and building of assessments to get advice from them about what ideas are actionable and what ideas are maybe a nice idea but are really not cost effective or doable. The goal is to have a decision document for the psychology board to vote on at their May meeting that basically outlines here's what we would want an exam to look like, and to then bring you, the council, a draft RFP, request for proposal, for what we would send out to vendors to bid on at the June meeting. Okay. We would then get bids from vendors to inform how much money and how long this would take so that we can take that back to the legislature next year.
Very good. I'll say from the conversations I've been involved with all y'all, is that it feels like other states are willing to have a conversation about it. Well, it's tough to say like, oh, we're all behind you, because candidly, there's nothing to be behind yet right now. Anyways, there is no test to speak of yet. But I have been heartened by the desire of states to engage with us, to have a conversation, who are curious, genuinely curious about what we're doing, have interest in what we're doing. So I'm glad that we're.
When is the requirement for the part 2? When does that officially begin?
That was the thing. They at the last second they abandoned the part 2 effort, but they immediately folded that into a complete reimagining of the test.
Okay.
So that's. Do we have? I don't even know if we have a date on that. Do we?
So
Where's the date?
They've announced recently. The expectation is they should have. I would expect by your June meeting, we will know not only the blueprint of their exam, which has come out, but also the cost. They've committed that they are going to announce costs.
That's
soon.
good. That would be new.
Yeah. So that is they've said in the next month or so. So I'm saying probably by June, because things always get delayed. We do have a mid-year meeting in North Carolina with them in April. So I'm expecting a lot of information to be provided there about what the exam looks like.
So that's just meeting schedules. That's April. Psychology's in May, and then we're back in June.
Correct.
Okay.
The original date was supposed to be January 1st of this year.
I thought so.
Yeah. So that, as Chair Linwood said, that I guess right before that date happened was whenever they decided to just fold everything in.
Is the anticipated date for the reimagined test January 1st of next year?
That I don't know.
I'm not sure. I believe so. They're rolling into beta testing, I believe, this fall. And so spring of next year, I believe, is when they are planning to have it offered for adoption. For those listening online, when the current EPPP 1 and 2 go away and it's only the new integrated test, they have not said, and that may be unclear for a while.
Okay. When would be the earliest that our exam could be ready?
2029 probably. And so we will very much have all the information we need to go before the legislature and know what we're comparing apples to apples in terms of cost and structure. And then other states will very much have a year or two with the EPPP integrated test to see how that's working before we would even offer an alternative.
Do you guys have any sort of line that if changes were made, we would back off on pursuing this? Or is it full speed ahead no matter what?
That's a question, and I think a lot of states, for a lot of states who were really with us and really opposed to ASPPP, when ASPPP took away the mandate, a lot of them said, "Okay, we'll wait and see what ASPPP comes out with." I made the point. I think we were talking to Tennessee the other day. I made the point. It's like, because that was one of the board members made that point. I was like, "You're not wrong." The difference is though is they were balls to the wall, not flinching, not moving. You better be ready January 1, 2026. We are not moving until they folded because the opposition was so great. Pricing can change. They have turned on a dime already. They could turn on a dime again. And the fact that we still haven't had pricing on this, on what the new test will be at this point, they can move that goalpost at any time. They can change it anytime they want, and they're the only game in town right now. So
True. For
me, the legislature gave us the money and said, go figure it out. And to me, the only point from my perspective to turn around is if the legislature says, now sit down, don't worry about it. That's their call, I think, at this point.
The only other thing I'd add to that, I think the pricing is a massive issue, but the other problem that we had back in 24 when we started having these conversations was for part 2 and now for this section of EPPP, they would not allow anybody to look under the hood at the data that supported some of the questions or how the responses were coming out.
Yeah, and remember that was a big issue for y'all. Efficacy was a concern, and they wouldn't ever give you any support behind it.
And it continues to be a concern. And like I get it. It's a company who created a proprietary product. They don't want to let people see underneath the hood, but that becomes a problem for us if we can't determine the efficacy of it. And I mean, I'm a public member. I'm not going to be able to opine on some of that, but our psychologists weren't allowed to opine on that either. And so I think that still remains an issue. And I mean, who knows, ASPPP could open up the doors and say, you know what, come look at all of this data. I don't know what happens at that point, but I'm not holding my breath waiting for that. So I would say the cost and the supporting data continue to be the primary issues that we have.
My problem is when somebody has a monopoly on something and they're asking us to use the regulatory force of the state to perpetuate that, we don't get any money from this test. Like, I don't think people realize that. A lot of people are like, well, how much are you getting? BHEC? 0, because it's not our test. When you're asking us to use the full power again of regulation to impose that, I think the psychologists who can opine on efficacy and ASPPB will be the first one to tell you that this test is not predictively valid. It does not predict if you're going to be a good psychologist or not. And so to me, I'm just like, well, why are we doing this? And why at this cost? It ought to do something to at least give the council some assurance that this person has passed some minimum standard that's going to be good to enter minimum basic standards for the practice of psychology.
Well, and I'll add to that, we've done, I don't know how many states, we've been doing a roadshow over the past few months, and there has been a significant amount of interest, as was mentioned earlier, in what we're doing and what we're looking at. Even states that are not necessarily saying like, yeah, we're 100% on board. I mean, the conversations are still happening around. We're interested to see what y'all are doing and seeing if there might be reciprocity down the road, even if it's not fully accepted. So we've been having good conversations. It's still in its infancy. I would clarify that. But those conversations are still ongoing, and they've been overall positive, I'd say.
And to reiterate, Texas has never said we're abandoning the national test.
Correct.
Quite the contrary.
Correct. And that's something that we try to start with in every conversation we've had. And I can't say it enough times. we're not abandoning it. We're not abandoning reciprocity with the EPPP. It's just, I think there's space for an alternative which hasn't been explored in the 60 years, 65 years that the EPPP's been around.
Yeah.
So obviously there's some very valid questions around something that's a generational, a once in a generation shift. But it's been positive conversation so far, largely.
My guess too is that, I mean, they're doing this combined test that most likely it's going to be more expensive than what currently just part one by itself is. That would be my guess, but I mean, I don't want to put words in anybody's mouth, but I would assume it's going to be more expensive.
Well, because they've, to that point, I mean, they've invested time and money, and I mean, they've spent several years developing this. So I would fully expect that it would be more expensive. But again, it goes back to the conversation of just trust us, this is necessary.
I'll be interested to have somebody explain to me how this new reimagined EPPP is different than just a mash of what was 1 and 2. So I would like to, when we get there, somebody I'd love to know the difference.
Without the pushback from Texas, they would not have backed off on the mandate and moved forward with the reimagined.
That the reimagined exam is a I'll just say it. It's because we stood firm. It was of Robert's diplomacy at the annual meeting, representing us really, really well. Our psychologists who were there, I think Dr. Becker was there. Mark, were you there? You were there? Yeah, Mark and Jamie were both there. Because nobody as not a psychologist, I'm an easy one to argue with, and I took a kind of a back seat to the arguments there, and the psychologists made the case for why we shouldn't adopt EPPP 2. So it was 100% because of our unwillingness or inability to.
Well, it makes me wonder, why didn't you do this version that you're moving forward with now? Why didn't you do that from the start?
It's a great question. You'd have to ask ASPPB that.
Okay.
We've been asking the same question. It is the $1 million question.
Okay.
And the question of how are you really going to measure the competence?
Say it again.
I said, and the question of how are you really going to measure competence?
Right.
Like ready to go, ready to practice. And that's kind of the, what we mull over too in some of our work groups right now is just like, how can we best capture that in an exam to show that licensees are ready to go and that they are ready, not harming the public, and that they're ready to rock and roll out there. So I think it's the ongoing question with ASPPB as well to see what their exam is going to look like and how it's going to measure it.
And something that I think should be added too is that we were talking about these work groups. This is being driven by Texas, but this does have national input, and that's been nice to participate in some of these work groups. Is seeing that it's become choose your own adventure in a way. There's conversations about modularity and what would we want something like this to even look like, because there's been a monopoly on it for the past 60 years. So it's brave new world.
Yep.
Good job. You've got our support.
Thank you. Any other questions, comments? Moving on. SB1 budget writer, Spanish language exam.
Not a lot of new developments on this area. Robert and I have visited with both ASWB and NASW Texas. We have met with them. We're actually waiting right now on ASWB to get back to both of us, both BHEC staff and NASW staff, about kind of the cost for developing a Spanish language exam. I don't feel like probably there's still a lot of appetite there, but they are at least they've opened up, I would say, a little bit more, and they are taking a look at it now. The short version of it is we still can't develop it. There's not enough money there to develop a Spanish language exam on our own, but we're trying to continue exploring with ASWB to see if they would be interested in it. I've actually got a little bit more detailed notes in that spreadsheet that has all our projects that we're working on, because that's one of the big ones under the immediate action items. You can look at my notes there. We're also, ASWB is also looking at offering instant translation as an ESL type option, in that they're going to see if that's an option, if that's something we could do. But again, we're waiting to hear back from them. So that's really the only thing I can report there. we'll have to, at some point this year, probably May to June, we're going to have to say, okay, either we need to have an action plan in place or we're not going to be able to do anything because I'm going to have to start reporting back to Appropriations and Senate Finance that hey, you guys gave us this money. There's no way we can do anything with it. We're going to have to lapse it back just so that they know we weren't ignoring the steps that we have taken to try to implement what they put in the budget for us. So there's going to come a point where we're going to have to do something though. But really, we don't have a lot of there's not a lever or a button that I can pull or push right now to make something happen.
And I will say, just from watching the legislature, watching the Finance Committee, I think it was the Senate Finance Committee, who I forget which agency it was. They've probably done it to a handful. I've watched them grill people and agencies who they allocated money to do a certain mission, and they did not do the mission. What's even worse is if you spend that money and don't do the mission, which that's happened to.
Yes, I remember I was in the hearing with you.
Yeah, and so we're not going to be
that agency. I won't name them, but I know who you're talking about.
Yeah. So this is one of those things that when you're going to lapse that kind of money back when you've been given a mission like that, you better have a real darn good reason and explanation for what you did in order to achieve it and why it didn't work out. And so in this case, there's some real structural problems in achieving that mission that can't just be solved by throwing money at it necessarily. So we'll have to just explain that when we get to that. We'll cross that bridge when we get to it with the ledge. So thank you for documenting and doing what we've done to get to this point. Moving on to 5E, discussion on whether to discontinue sharing the complainant's identity in the enforcement process. This came, I actually forgot about this. Daryl gracefully reminded me that this was at my request from last meeting. And there was a public comment last meeting that I thought it was raised a particularly good point, but based on how we can't respond to things unless they're on the agenda, I asked for this to be put on the agenda. There was the comment, essentially, you have it in your packet, but for those watching on Zoom, I'll simply paraphrase and kind of summarize this. There was concern about the complaint reporting process being a chilling effect to somebody making a complaint because you have to disclose on a complaint who made the complaint. And she was asking, I think it was she, was asking that the contact information of the license holder who made the complaint not be shared with the person you're filing a complaint against. You can't really do this, though, because everybody has, I think, a right to face their accuser. And then also in terms of what we can do and can't do with anonymous complaints, there's not a lot we can do. They're really hard. So she talks about it, the supervisees are fearful to make reports of unethical behavior. Sounds like retribution is actually retribution is mentioned, or harassment, and that we should stand behind licensees trying to do the right thing by clients and colleagues. I agree with all of those sentiments, but I'm curious. I'm going to put some of our lawyers on the spot. Don't people generally have like whistleblower protection, like and do our what would happen if somebody actually retaliated against a complaint?
Well, apart from that probably being a rule violation, if it's one of your supervisees that you're retaliating against for filing a complaint, my guess is there's probably something in the rules that already precludes that type of conduct or behavior. I want to kind of talk a little bit more about the practical legal implications of why I have a little bit of, I understand where this commenter is coming from. I get it. And a lot of times people will point to like the medical board, for example, where you can submit a complaint to the medical board and your identity as the complainant is not revealed. Now, I looked the medical board statutes up last night. They actually have express statutory authority to do that, though. We don't have anything like that. Their statutory authority also limits it, though, to only those complaints where the complainant is not going to be testifying. So in other words, the medical board can't hide the identity of somebody who they're going to have to put on the stand in a contested case hearing. And in the situations like what the commenter has set out in her statement to us last time, those are all going to be situations where we're going to have to put you on the stand to explain what happened. And so even if we had something similar to what the medical board has, I don't know that we could hide your identity at that point. Because again, you've got the right to confront your accusers. I'll just say it, and I know nobody likes to hear this, but I don't know a solution to the problem that she's talking about. I don't know what to do about that. And quite frankly, I'm not sure that it should be this body. This is just my, call it political advice. I'm not sure it should be this body making that kind of a decision, because what you giveth to the commenter here, you're taking away from somebody whose license is on the line. Yep. And sometimes what we have learned is things get filed. Sometimes things, are filed wrongfully or have kind of wrong motives. And maybe we need to know about that before we are prosecuting somebody for, the wrong reasons. We've seen it many times on, I'll just say like anti-competitive. Well, I'm going to knock my competitor out. I don't like that person honing in on my piece of the territory here, and they file a complaint for whatever reason. And we come to find out in the middle of the complaint process, we're like, oh, you're a competitor and you're trying to knock him or her out of your zone or your market. That tends to brings things into a little bit more clarity there. So there is some value in sharing the identity of the complainant with the respondent in that case. So it's a coin that both sides have some value to it. And I'm not sure that, it seems to me like that might be a legislative question. Let the legislature debate that over there rather than taking a piecemeal approach. This agency allows it, this agency doesn't. And all of a sudden we've got this fragmented, patchwork of rules and regs out there. So just my advice is kind of proceed with caution here. Now, Robert and Patrick can have their own opinion. I don't disagree.
It was just I thought it was a question that comes up from time to time that I felt deserved a explanation of why it is the way it is. There's no system that's perfect, but this is one where I think the downside of changing it out does not merit changing it. So
I'll just add, I just want to say I totally agree with everything that y'all are saying, and I'm 100% on board with that. I know, like in Abilene is a small community, and so sometimes therapists don't want to, rat out, a therapist that you're going to be possibly sitting across from and at lunch one day, you know what I mean? So I totally get that sometimes it's not even necessarily supervisor and supervisee. It could just be your friend, you know what I mean? And so I definitely understand kind of that resistance. I know one of the things that I talk about in my program with my students is just that sometimes when we are making complaints, we have to have a little bit of moral courage. We have to make a complaint knowing that we are, putting things on the line. There could be fallout from this, but that public protection outweighs our sense of loyalty to our friends or to our supervisor. And so sometimes we just have to have moral courage to do the right thing. And so for anybody listening who's in that position of feeling like they're not sure if they should make a complaint or not, I would just encourage you to do it. I don't know. And just have the courage to do it.
And to that point, in our experience, I'd say the more awkward it feels, the more likely you are close to the person, and thus your identity is going to need to be revealed. Right? If you are complaining in a way that you are so removed that you want to be able to just say, well, I'm irrelevant, so don't tell them I was the one that complained, the less likely you're going to care about being the one who's complaining because you're so far removed. And so, the vast majority, it is awkward because you are involved and you need to be the one stepping up.
Right.
I will add, just so that I come across, I know, as harsh sometimes, probably in that last statement I made, but I am sympathetic to what the commenter is saying. Yeah. Let me tell you what we have done in the past. I have had people call me, reach out via email, and then I called them, and they were struggling with this. I know the person that has done something, and they're like, how do I handle it? And I'm like, well, tell me, my pen's down. I don't know who you are. Just tell me what has happened so that I can walk you through it. And, sometimes I'm able to walk them through it to where I'm like, you do the best you can. You have the come to Jesus meeting with them, meet with family and friends if it's something that needs to be confronted that way, whether they've lost capacity, they're no longer able to practice or what have you. Try to do what you can from your perspective. But if it's something that the agency could come in as a complainant on, we're sensitive to that. I have signed complaints myself before, so that in order to protect somebody who I thought, well, okay, I get it. You don't want to sign off on your colleague. I understand that. I don't need it. I just need some basis. I need somebody to give me some basis so that I can sign a complaint, and I'll be the bad guy. We're willing to do that and talk with you, but you got to call us if you've got a situation like that. Robert, Patrick, and I, we're happy to visit with you about it, and we'll tell you if we can or we can't do anything like that. Now, it may be a situation where even if I signed off on it as the complainant, or Robert signs off on, he signs complaints, even if one of us do, we may still need you as a witness. It just depends on the nature of it, and that's why it's important. Call us, talk to us about it, and we can maybe try to shepherd you through that rough spot.
Let me ask you, I'm a licensee. I'm not a licensee. Imagine I'm a licensee for a minute, and I'm freaked out right now that somebody can call and tattle on me, and you'll file the complaint on me. Can you give, without giving away any details, like the level? I think I know the answer to this question, but it's how high of a bar is that, and how egregious of a complaint are we talking about? If that's, or what's a situation? Can you talk to a general situation that you would consider doing that?
Well, I would think hopefully you would realize the value in maybe having somebody call one of us first, because we're going to be able to vet it and go, that is not a complaint. You just have a personal problem that you need to go resolve on your own. Use your interpersonal skills to resolve that problem and not invoke the powers of government to do it. We're not going to sign something that's going to get us into a frivolous action where we're barreling down the highway, and there's absolutely no basis to it. You're far less likely to get a frivolous complaint if one of us is the one signing it after interviewing somebody than just somebody out who is, that they haven't sought any kind of advice or guidance on it, and they're just like, well, I feel like this might be a violation, so I'll file the complaint. Okay, well, at least we're vetting it whenever we're doing that.
But it sounds like that's probably something pretty egregious or some extenuating circumstance of why you would sign it versus a complainant.
Yeah. It could be egregious. It also could be complaints where we feel like, yes, there is a violation. Something does need to be done about it. But we also don't need to burn all the buildings in that person's life down. And I can do it a little more gently than them feeling like they have been ratted out by their friends and family. It's just me being the bad guy at that point. But as far as it being egregious, it doesn't bother me to sign an egregious complaint. I sign revocation orders all the time, so I don't know if that's what you were.
I'm just trying to figure out to give licensees some solace. If we look at the revocations that we did today, those are all. I think no one needs to be worried about y'all signing something that's piddly or just BS hearsay or something like that. If I'm going from memory, some of the stuff we saw today, it was people pencil whipping hundreds of patient records. Big things that we're going to that level for.
We have 900 pending complaints. We're not looking for more.
Right.
So,
thank you. All right.
We're a growing agency, but we're not so big that we have lost all our personal touch yet. We're more than willing to help you guys out if you find yourself in that kind of a pinch.
Moving on to 5F, discussion on what steps the agency can take to assist connecting the public with licensees for accessible and reliable mental and behavioral health service. Discussion to be led by Councilman Taylor.
Chair, I thought we discussed tabling this one.
Sure, you can table that one.
Yeah, thank you.
Moving on to G, annual rulemaking window. I'm reminded of I've invoked this before from the Federalist Papers. I think it's Federalist 62. If the laws, I'm going to butcher the quote, if the laws be so voluminous and so ever-changing, it will be a little avail to the people to have their liberty and predictability. I'm going off script, but it doesn't do much good for anybody if the laws are so ever-changing that we don't know what's in them, or so vast and so incoherent that they cannot be understood. I do feel that way about our rules sometimes. I think that this is an effort to tighten up the ad hoc, the seemingly endless nature of rulemaking that we do to give it some structure. So you want to take it away?
This is something that kind of arose out of staff discussions. We want to exercise a little self-restraint in this area, and here's where it's coming from. I mean, in the past, you guys see the sheer number of rules that are up for adoption. All of those have gone through the full process to be proposed, and you know what the process is. You all come from the member boards. You know how lengthy and tedious that is. Well, so does everybody out there in licensee land who is trying to track and figure out what changes we have made. And one of the things that I began to see early on in our customer service survey and our strat planning survey that is now concluded, and I'll be giving you all the report on in June, is one of the biggest complaints we get is slow down on the rulemaking changes, guys. You're killing us. We can't keep up. And it's hard. A lot of them don't understand the tools, how to use the tools they have at their disposal to track those changes, because I'll admit it, you've got to almost have to be a policy wonk or kind of an administrative nerd to be able to really utilize those tools to the maximum and track all the changes and understand where they're coming from. So I get that. I am sympathetic to that, to licensees. But on kind of the flip side of that coin, I will tell you it's a lot of work on staff too. It takes Robert, Patrick, all of those people right there. It takes everybody on this row right here to track all of the rule changes that we make. And we're tracking it in 3 different ways so that we make sure we don't screw up and miss something and leave it off of the agenda. I won't geek out on you too much, but I've got a spreadsheet that is kind of our primary thing we track with. And then Robert has his own system. I have my own system. And then Patrick and Brenda are tracking it themselves as well. So it's a lot of work. And what I feel like, if we kind of consolidate it down, you guys are meeting 3 times a year. If we consolidated it down to where you had 1 meeting where you proposed, 1 meeting where you adopted, all the member boards know that's my window to get it in. They will focus their rulemaking efforts so that they can get everything up to the council by, say, its June meeting. And then that makes it a lot easier on licensees. They only know, I really only have to focus on, if I want to see what changes were made, I only have to look at that about that October meeting to see what changes came out of the council and the member boards. Now, this does not put any kind of restraint on the member boards. They can still engage in whatever kind of rulemaking they want to. You know, they can do town halls, they can do surveys, they can develop the rules all they want to. I just don't want them coming up to the council until about June for proposal, and then an adoption meeting in whatever our our October or November meeting is. It does one other thing too. It makes sure we're not doing rulemaking while the legislature's in session, because that is incredibly difficult. That puts a lot of load on me, having to watch all the statutory changes that are making, working their way through the legislature, and then also having to track all the rule changes that we have going on. Now, what I'm asking for here is it's almost like a self-prescribed restraint. We don't need a rule to do this. We don't need a policy. You guys could change your mind at any time. What I'm just kind of asking you is, hey, we're pledging, we'll hold off all the proposals until the June meeting, and then we'll do the adoptions at the October meeting. And then that word of that will obviously trickle down to the member boards, and they'll know if we want to get something proposed, we got to have it in by that June meeting, and then it'll be adopted at the October meeting.
How does that work in terms of the ledge? The ledge gavels out. I feel like I can categorize our rulemaking into kind of 3 categories. 1, responding to the legislature. Mm-hmm. 2, responding to a problem that we had. Or 3, trying to move the ball on some, like with this ACU stuff, like moving the ball and making things better. So one of the 3. How does this work? Can we get this to coincide with changes from the ledge to where we can cleanly propose that our ledge proposals fit neatly into this understanding?
Yeah, well, by June, the legislature, you'll already have sine die by the time we meet then. So
that's when we're going to start this process, essentially?
Yeah.
Okay.
Yeah. Well, I mean, if you'll notice, we don't have any proposed rules on the agenda today. So this year will actually be what I'm proposing. It just happened to work out that way. We can structure it in the future to where we make sure we have a little bit of time in between our first, what we call a proposal meeting, and when the ledge gavels out sine die. Although, to be fair, I generally know pretty well what's going to be law before sine die, because it's usually either the governor's already signed it or he hasn't vetoed it, and it's just waiting to become operational by law. So we'll know what we need to do in advance of the proposal meeting, if you will. And then the adoption meeting is just making sure that we have enough time that it's proposed in the register and that it can circle back to the member boards in time, just setting it far enough out where it can go through that process. Now, again, remember, because we're not putting this in rules, not in statutes, not in a policy, you guys, if something jumps up and you're like, oh man, that's a big problem or an emergency,
we call special meetings.
We call a special meeting, or we just deviate from it. If you got to do something in January, you're just like, fine, put it on the agenda.
Yeah.
That was going to be the only question I had is if we do proposal in June and adoption in October, like I'm thinking during the session, so many laws take effect September 1st.
Mm-hmm.
And so there's obviously that gap between 6 weeks or so between 9/1 and October. So I guess we would just, on a ad hoc basis, if something had to get done by 9/1, then we could just do it ad hoc.
Yeah, well, a lot of times we can just do it, even without technically the rule being in place. We actually do that quite a bit. Anytime the legislature says, thou shalt do this, we're going to do it regardless of what our rule says, because we got a statutory mandate to do it. So it doesn't really matter if you have the rule in place. You got a statute.
I figured that was the case, but I figured probably...
We've usually already got if it requires something in the database, Jenny's usually already got it built out and ready to go well in advance, so that we're just waiting on you guys to adopt the rule. Honestly, we don't even wait until, technically a rule change isn't valid until 20 days after it's been submitted to the register following adoption. Generally speaking, we're pretty good about just going ahead and implementing it because we're ready to go once you guys have it.
Does that line up with the budget calendar?
Yes. Yeah.
Like right on it. Proposal in June, adoption in October.
No. The fiscal year ends August 31st. So no, there is a little bit of an overlap there. Or the adoption goes beyond. It goes into the new fiscal year.
But it's
close.
It's the best choice.
Yeah, it is.
Okay.
Yeah.
So to put a bow on this for all of those listening and for the council and member boards, the idea is that we don't need a rule to do this, because we do want the flexibility. If we need to make a new rule or engage in rulemaking, we can at any time. But the understanding is that we're going to do an annual rulemaking cycle to where there's essentially one start line to where you can see everything happening at once, rather than you've got things. Well, it was like their cohort, their staggered cohort. We're going to have one start. We're going to run all these through, and then we'll have another one and start it through, rather than having three. When we had 4 meetings, we could potentially have 4 cycles of rule changes all in different stages. And that's hard for me to keep my brain around. I can only imagine.
And again, it does not restrict the member boards. They can keep doing whatever they want to do in terms of rulemaking.
So no action needed, but general understanding that that's where we're headed.
Right.
Okay. Any other further questions, discussion? All right. Hearing none. Okay, so we've got that. We have already taken care of H. We can take care of I when we go into rulemaking regarding 884.11. J, discussion of pending litigation. If we need to do that, we can go at the end, but we don't.
We don't need to do anything.
Okay.
There isn't any developments.
Okay, so with that, everybody's still doing good. We ready to go into rulemaking? All right. So, how did we do this last time? Did we take a single motion last time, or did we do these in 4 motions or 5 motions by
I would do I would do a motion at least for BHEX rules alone, because you got that 884.11 in there with the petition for rulemaking coupled with it. So
that's right. Okay. Can we take the other?
You could do the other 4 as one group. Yeah.
Okay. So when I get through this, I'll entertain a motion to take action on all of 6, and then for 7, marriage and family therapists, 8, Texas State Board of Examiners of Psychologists, 9, Texas State Board of Examiners of Professional Counselors, and 10, social worker examiners. We can take a motion if the council so chooses to adopt all of those en masse. And if any member wants to pull out a specific rule to vote differently on it or to discuss it differently, I would certainly entertain a motion to pull that out without objection, so that we can take anything up separately. So is everyone good on that? Okay. So opening up 6. B, consideration and possible adoption of the following proposed rule changes. 88411 is probably the most hot button one. And we have a petition. I think the idea is the draft would be denied and then we can take action on that. Am I getting that correct?
Yes, the staff are recommending denial of the petition.
Discussion? Motions?
We're on 88411, denial of petition.
Yes.
Well, it's from 5I.
Yeah, 5I. We're taking 5I. We're taking it with this though, because of like subject matter.
I'll just to open up the floor for discussion, say that I understand the petitioner's concerns. I mean, when I first read it, I was also a little bit concerned. But I do want to, I guess, be clear that like staff will, my understanding anyways, and y'all correct me if my understanding is incorrect, is that staff will basically handle the ones that don't require professional opinion. So like if somebody did not release records within 15 days, that's pretty open and cut, like open and shut. You don't need my professional opinion on that, right?
Even I could do that.
Yeah, like, but things that involve, boundaries with clients or like professional standards, like in our rule, you'd find under 801.44, like those are the things that like they will bring staff in, or the staff will bring in a professional member to weigh in on because they don't have the expertise.
Right.
But the things that are really clear cut, like one of the ways that we can get through this backlog of 900 complaints is by allowing staff to close some of these more obvious ones.
Correct.
Is my understanding correct?
Yes.
Okay.
It sounds like just about anything with client-wise at all, like involving a client directly in any way, is going to be still, it's going to have a professional member.
I'm going to just point out to all the members of the council, to the member boards who are, will look at this or listen to this later. Y'all can take this back to your member boards and to the members of the public. The council and board members get to look at anything. We conduct oversight over this agency. And so if there's a question of anything that I've heard, I don't know if I've heard it specifically from any council or board member, but if a council or board member is concerned of staff running amok, the reality is any one of us at any moment can ask to see whatever file, ask the status of anything, interject our opinions. The only thing that you need to consider is that potentially you'd be conflicted when voting on it if you got involved in a case in that way. But we are all empowered to conduct, and it is our job to conduct oversight. So this doesn't change that. And I'm sympathetic to the arguments about oversight and making sure that staff is doing it the right way. I am sympathetic to that. The reality is that this is kind of one of those these changes. When I was over at psychology, when Daryl was there when we started in 2016, we were a small agency with a small number of licensees, and the ISCs were like a 2-day thing, and we were able to manage it with our licensee population. It was small enough. When you got 90,000 approaching 100,000 licensees under the council, there ain't enough board members, council members to do the ISCs, and so that's where. Imagine a scenario where if you have to have a board member present, imagine for some reason they're not, or we get snagged and then they throw out the case and we got to go do it again. Like I think the idea is that board and council members should be involved, but it can't be a fatal flaw in prosecuting or dispatching with a complaint. So I am sympathetic to the arguments, that don't like the changes though.
Go ahead.
So explain to me how this will work if staff determines that an ISC is appropriate for just a staff involvement, but the respondent is represented by an attorney, and the attorney believes that there should be a professional member as part of the ISC. So we have a disagreement. How's it going to be handled? And let's say you move forward with just staff involvement on the ISC. They don't get the result that they want. Can that be challenged as an abuse of discretion or error that can be appealed, for instance? Just how are we going to settle that?
So yeah, there will be several sort of safeguards in the process, particularly that we've been adding in response to everyone's comment about this rule, because we do want to be above board. So for one thing, staff will generally try to have a board member present at all ISCs. We don't object to a board member being present. We like you guys. But particularly because of the scheduling issue, we don't want to have to wait. We don't want to have to cancel an ISC because y'all are not available. And so that is an overriding emphasis. We don't want it canceled and we don't want it reversed later. When it comes to a decision about can we go forward without a board member, that's my decision. That's me. When we're talking about staff, it's me. And so it is not our line staff, it's not our attorneys. Not that they couldn't make that decision, they're very capable, but I just wanted to communicate it is an executive level decision. So I am absolutely okay and happy if any respondent or their attorney wants to request and say and explain to me why, hey, this is really important. And we can add in our notice to them about the ISC if we know ahead of time that there won't be a board member. We can add that language in the notice to let them know in case they have an objection or they think there is something wrong.
Yeah. Question. So when at the board level, the member board level, when these things are coming up for ratification at the board, in the response to the complaint, we would see if they requested in the response that they requested a board member as part of the IC, yes?
You could.
We would.
Yeah,
I mean, if they wanted to do that.
Response,
yeah, so there's a way for them to put it on the record, at least in terms of a check and balance here. And you say no and they wanted it, you're going to have to explain to the board why you didn't necessarily.
Sure.
Right?
And yes, but I also say that will get to...
Are you talking about would the board see when they're reviewing, like let's say it went to SOA and then the case was brought before the board, would you look at it at that point?
But doesn't it touch the board before it goes to SOA?
No, it touches
first?
the full board afterwards. And so the record is created at SOA, and so the record of the proceedings is what you would see. So to correct it, I don't know that we would any of the ISC or prior stuff. If the response is entered as like an exhibit at SOA, then it would be. But that I don't know that necessarily would be entered into the SOA record. So I don't know that would be every single time be something that would, whether or not they requested an IC with a board member or not. I think it's important though to take a step back and talk about the due process and what this actually is. And it's not a hearing, right? It's an informal settlement conference. Many people are thinking this is a full hearing and they're making a final determination. It's not. It's a informal settlement conference. Is there a potential violation and can this be resolved? Or does it need to potentially go forward? So, but I just wanted to clarify. I don't know that you would get that information.
That's a good point.
So to that point on SOA, do we know, or have we had any conversations over there about? I mean, I could see a situation where it starts becoming consistent that you have a licensee who there's an ISC, no board members are present, it goes to SOA, and then that case is made to SOA of, I didn't get a fair shake at this ISC. And do we know how SOA might rule on that?
So yeah, let me address that, because to that point of what happens if we disagree and we don't have a board member present and they wish there was a board member present and they don't agree to settle. Well, the next stage in going to SOA, we would have to prove the violations at SOA. And so one of the natural steps would be if we go to SOA and we say, here is our evidence of a violation, and SOA says, well, where's your professional expertise to say that's a violation? And we don't have a board member and don't have an expert witness reviewer, well, then we have not proved the professional. That is where that would come in. We would lose.
Yeah.
And so that's part of our incentive to have a board member if there is a professional matter, is because if we can't prove that going forward, we're not going to win at SOA. And so that is where, again, this is an informal conference to try to settle. If we did go forward at that point and they said, well, no, but here are professional matters that need a professional judgment, we would get an expert reviewer and we would provide them that expert reviewer opinion if we were going to use it at SOA. And they could then counter that with their own opinion. So that's the adjudicatory step of fighting out what is the professional standard.
So your point is it's sort of self-correcting for the fact that if the agency is at a disadvantage by not getting a board member if one was required.
Well, if we certainly couldn't go forward with an administrative hearing without proving the underlying professional standard.
So it sounds like the primary. Again, this just reinforces why the primary person the staff would be handling these alone is it's going to be cases that are open and closed, that are very obvious, that you would not need a professional opinion on, that are very clear cut.
Yes.
Because otherwise you're going to need a professional opinion.
I'm thinking of one. I remember as a school psychologist who didn't produce records for a parent one time.
Mm-hmm.
I didn't need to be there. It was very clear. She didn't give the records, and we all saw that. I didn't have to be there.
Robert, I like the way you explain that, because now I see it as you're thinking ahead to the final SOA hearing. And if I would have to have a professional opinion on there to win at SOA, then I'm going to back it up to what I would need at the ISC level. And then at that point, I will need the professional member as part of the ISC. That's how, am I reading that correctly?
Exactly.
Okay.
And
that it makes me feel better too.
And it doesn't stop there. Again, just because we don't settle at an ISC doesn't mean we must have an administrative hearing. We are still working with these licensees. If their attorneys have more feedback to give, if they want to try to settle this, we can settle after an ISC before going to SOA. And so that is still open. That is still a pathway to get more professional judgment. And there are times where we get out of an ISC and we can't resolve it, and the agency looks at it and decides, you know what, we can't win this, and we dismiss. That does happen. Rarely, if it gets to an ISC, but it does.
But it sounds like there'd still be maybe an opportunity, like if something goes to an ISC with only staff, y'all cannot reach an agreement, you could still bring in a professional board member to weigh in on it. Is that
Absolutely.
correct?
And that's part of the language in the rule, is that if we have the authority to bring you in to advise us on what's going on.
Or multiple members.
It just means we don't have to repeat an ISC, a gathering of all of them together.
Okay.
We can do it by email. We can.
Right.
Yeah.
Question: what percentage do you think that this is going to affect? Like where we would enact this? I mean, because we're doing it to become more efficient, more timely. We've got this. I mean, Texas is continuing to grow. We've got, this problem's only going to get worse if we don't obviously work through this. So, but I'm just kind of curious, like what do you see? How much, like percentage wise, how much you see this like saving in terms of where it would be utilized?
That's a really hard question to answer. I think to sort of help answer that question, but it really goes back to, if I can answer Chair Halbauer's question, which was about grounds for appeal and sort of what they're talking about in the process. And so under this new proposal, if let's just say that an ISC was conducted and all that was discovered prior to it it's just a record violation, and they didn't, and then all of a sudden in the ISC it comes out a whole host of other problems happened, and we were like, what about this? And so it would have been beneficial to have a board member there, but we didn't have them there because we didn't realize it. So additional investigation is needed. The requirement under this rule we could then ask a board member for an opinion or go get a professional review and then proceed with a SOA hearing and not have to go back to have a second ISC or get hung up on, well, if we didn't have it and if they appeal this, or if we're at SOA, like Chair Bridges was asking, if they're at SOA, are they going to raise that issue? Or on appeal, I think what Chair Halbauer was talking about, if they appeal to district court and say, well, this rule said you had to have a board member and they weren't there at the ISC, so you need to throw the whole thing out. What this does is this creates the flexibility for, okay, we can consult with that board member after the ISC, or we can just streamline and have it go all the way through. But that takes out any argument for grounds for appeal or the argument to be made later on. So it makes the process more efficient. But the ultimately, to answer on your question, I don't know. I don't have a good number for you. I don't know the answer to that. This is just looking to say, can we make this process more efficient? And that's what the intent of this rule change is.
And if I'm being honest, to the question of how big of an actual on the ground impact this rule change is going to have, not that much really, because we are already doing this substantively under the existing rules, because staff is allowed to have ISCs with staff only if an expert reviewer is not necessary. The way it is worded is a little more conservative in its approach, so we have been a little more cautious. So we will be a little less cautious, but we're still going to invite board members who, as long as they're available, will come. So I don't see it actually changing the numbers all that greatly.
And at the end of the day, you would be able to bring a professional member in if you saw it fit or needed in that case, right?
Absolutely.
And the reality too is you're also dismissing some things before it ever sees an ISC.
Correct.
Yeah. So like you're sort of already doing this in that regard anyway, saying there's no merit here and made the call. So it's to me it's codifying something that sort of already functions. It just it's
let me just say this. We're already doing this. How many problems have you seen come from it?
None.
Okay. What I said earlier, the best predictor of future behavior is what we've done in the past. So, I mean, we're already doing this. Staff are already making the decision of when to bring in a professional reviewer or a professional board member on these things. So, I mean, to some degree, there's a measure of trust. You guys have to hire us and you have to trust us to carry out whatever it is. And I think we've done pretty good so far.
And again, for any council member or board member that has concerns, we still have the prerogative to go check any work that we feel like at any given time. Hang on, one more thing. I want to just, this last thing, I was listening to public comment earlier from Dr. Gomez, and I made a note about this. I heard in there, and I'm not picking on Dr. Gomez. I think he made a lot of great points, but he was concerned about excluding board and council members. There's nothing about this rule that excludes anybody, because it's not prohibitive. It just says we don't have to. You don't have to be there.
And LPC's just made a change to where all 9 of us have to be available for ISCs. So it's not exclusionary on our end for sure.
Well, we kind of opened it up on our side too on psychology because we have it is.
But we're really dominating you on complaint numbers. I'm just saying.
That's fair. That's fair. Well-oiled machine. No, but I mean, we opened it up too because, like, historically, we would go through rotations on it by quarter, and it turned into over the past few years where it was just like a small group of us that were getting tagged on these ISC calls, and so we've, to that same point, we've kind of gone back in that direction of opening it up to all board members need to be involved with these. And I was just going to say too, thank you to both Patrick and Robert for fielding all these questions, because I think, I think there's some good concerns that have been raised, but I think there's also been a misperception of how this actually plays out. And so thanks for letting us grow you on this and flesh out the way this actually would pan out in reality. Because I do think, as was mentioned a second ago, it seems like the individual boards are actually opening up for more, or pushing for more board members to actually be involved in these. So opposite direction. And I think that's positive. So
that allows the board members and council members to be involved where they need to be involved, and not on all of them, to be on the ones that really count and really dig into it. So like I said, I'm just thinking about that one, and many of them. I just remember that one where, again, you don't need a professional. Any dummy like me can see that the records weren't produced. So
I evaluate it as balancing.
Yeah.
Can we move something over to the other side and we still have good balance between efficiency and transparency and fairness and looking out for the public, but also really protecting our licensees. And so it's still in balance to me.
I'll just add, I just want to echo something you said earlier, Chair Blumenowitz, and that is about oversight. I know that I don't know how the other boards work. My understanding is that they might work a little bit differently, but like our ethics committee meets every month or every quarter, and we review like all the cases that staff closed as well. So like, of course, we have a very small number. So you're talking like we review like 4 cases. It's not a whole lot, but like that's part of our oversight. So that when staff is making these decisions independently, like we're still seeing it. Does that make sense?
Yeah, and that's the point here. I mean, this is the council which has approaching 100,000 licensees.
Right.
So
Yeah.
at this level, we have to think about it differently. All right. Any further discussion? We need to dispatch or do something with the petition for rulemaking, and we also need to do something with the rules. So probably cleaner to take those motions separately. Does it matter which order we do them in?
I would dispose of the petition first.
Okay, so petition for rulemaking.
I'll move to dispose.
Move to deny it. Is that correct? Move to deny.
Yes.
Okay, it's been
I'll second.
it's been moved and seconded. Is there any further discussion? Hearing none. All those in favor of denial of rulemaking signify by saying aye.
Aye.
Opposed, say no. The ayes have it. All right. So moving on to rules before the council is 6B, the whole list there.
There is one change. It's a typographical and non-substantive change that we will need to make to 885.1, the second graphic, the B2 graphic. There's a statement at the beginning of it. It says application fees effective for applications submitted after August 31st, 2023. That effective for applications submitted ... That needs to be removed.
Which rule again? Which rule number?
It's 885.1, and it's the attached graphic B2. Yeah, if you've got it. Robert's going to put it up on screen.
For cleanliness, so is a date? Was it a date change?
No, that was a statement. We just forgot to repeal it, strike it when we were doing the changes.
Okay.
At one time, we had 2 different versions of our fee chart attached to that rule so that we could show people, here's what the fees were prior to September 1st of 2023. And then we did a fee reduction, and here's what they are after September 2023. Now that we're doing away with both those graphics and just keeping the most recent one, we need to take that language out because it doesn't make sense in there anymore.
All right. So if the council were to take up the BHEC rules and adopt 88411 with the others as ready for adoption with this change, can you tell us how that motion would need to be cleanly made?
Move to adopt the rules under 6B with the stated change in 885.1, the second graphic.
If that be the council's will, you've heard the motion potentially.
I will make a motion to do exactly what Daryl said.
It's been moved.
I'll second.
And it's been seconded. Is there further discussion?
This includes 884.11?
It does.
Yes, sir.
Okay.
Further discussion? All those in favor signify by saying aye.
Aye. Aye.
Opposed, say no. The ayes have it. Thank you. Okay, moving on to if it be the council's pleasure, we can take up 7, 8, 9, and 10 en masse. Yes,
you can.
Okay. So, is there anything among? Again, we've had 2 bites at the apple. Public's had 2 bites at the apple at this already, and this today being the 3rd. Is there any discussion? Anything that y'all would like to take out or take up separately?
No proposals.
Yeah. I might have
for adoption only. Yes, ma'am.
I guess Mr. Francis or Dr. Francis, I don't remember which his title is, talked about I guess some things related to 10B, but I wasn't sure what he was talking about. Can somebody maybe explain?
I'm happy to explain. So the proposals under the social work rules under 10B are largely recodifying the rules. That it's mostly moving things, so not a lot of substantive changes, though some to particularly the supervision rules. The two things he noted. One, he noted about the qualifications for licensure, the description of the degrees that are allowed. He noted that the language says for an LBSW and LMSW, you can come from an accredited program or a program that is a candidate for accreditation. But the LCSW rule does not say that. That is because that's exactly what statute says.
Okay.
So we align those exactly with statute. His question is a good one. I have no idea why the legislature wrote it that way, but we're just following exactly what they wrote.
Okay.
And so someday maybe that will get addressed in statute.
Okay, thank you.
The other thing he noted was under 781.403, the new version, it correctly noted the top of that rule lists things that all supervisors who are supervising the practice of social work need to do. They need to keep records of their supervision. They need to make sure their supervisee is following the rules, the social work rules. He did correctly point out, as a quirk in the social work rules, clinical practice by an LMSW who is not seeking licensure as an LCSW can be supervised by an LPC or an LMFT or a psychologist. Under the reading of the rules, that would then suggest that LPC or LMFT or psychologist must follow this social work rule in terms of keeping records and making sure their supervisee is following. And his point being, why would that other licensee need to know the social work rules, and how would they know what to do? All a fair point. What I would say is they have voluntarily engaged in supervising the practice of social work. And so, yes, it would be appropriate to say you are now, even though you are not licensed under the social work board, you are voluntarily supervising the practice of social work. You should ensure your supervisee is meeting the standards of a supervisee, that they know the rules of social work, that you're keeping track of what your supervision is. The list of things that are required are the fairly bare bones of any kind of supervision. It's not for licensure. And so it sets up a unique situation, but one that I think is appropriate in this circumstance.
Okay. So would a LMFT supervising an LMSW be beholden to the social work rule?
That's a good question.
Okay.
They would not be subject to sanction by the social work board. They don't have a social work license.
Okay.
But they ought follow the social work rules and be a good supervisor.
Okay.
And I'm sure if they did a bad enough job, they would probably be violating the LMFT rules too.
Yes.
And so I'm not really concerned about the situation where there might be an LMFT supervisor who's not meeting the letter of the rule, but they're not really breaking LMFT rules. It's probably a unique situation.
Okay. Thank you very much. It's helpful.
All right. So didn't sound like there's anything we want to take out. Is there any further discussion of any of the rules? Hearing none, I'm entertaining motions. This would be to adopt the rules as not as proposed. Adopt the rules as proposed. There you go.
I'll make a motion to adopt the rules as proposed.
All of them on 7 through 10? Through 7 to 10.
Yes,
You've heard the
7
motion.
to
Is there a second?
I'll second.
Been moved and seconded. Further discussion? All those in favor of adopting the rules as proposed on sections 7, 8, 9, and 10 signify by saying aye.
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 Opposed say no. The ayes have it. Thank you. Moving on, we're wrapping right up. We have all talked about a lot of good things happening at our member board. So on 11, if there's something we haven't discussed yet that you would like to inform the public and the council, feel free. Don't feel like we have to. In the interest of governing efficiently.
I can report on MFT.
Go for it.
So at our last board meeting in January, we talked about maybe some changes to the CE rule. And so I will be meeting with all the member boards to propose my radical plan for revising our CE rules to make it more flexible, give more space so there's less required little buckets. And so as y'all might remember, we did a whole CE survey, and basically we developed this potential rule out of this particular survey. So I will be going around and shopping that around to all of y'all in the next couple of months. We also completed a supervisee survey, and I learned today that LPC, y'all also did the supervisee survey with your supervisees. So that's awesome. Glad that y'all did that. Anyways, I'm still in the process of analyzing all of our results, but I will just kind of give y'all some preliminary results. One is that graduate education alone does not prepare students for every single thing they will ever need to know as a marriage and family therapist. I know that's probably shocking to y'all, but we actually have evidence that graduate education alone does not do that. And so supervision is essential for helping prepare graduates to be able to be ready for independent practice. We also learned that one of the other things we're looking at in the survey was just is there widespread exploitation? Is supervision harmful? Is it insufficient? And what basically, I'm still kind of analyzing this part, but what we learned is that there is no widespread exploitation. There does not seem to be that supervision does not seem to be widely inefficient, that supervision does not seem to be widely harmful, that cases of insufficient supervision or of harmful supervision seem to be pretty rare. And so our next steps are basically to finish processing the results, and then I'm hoping this summer to do a survey of supervisors to kind of understand their perspective on all of this. And then maybe in the fall or next winter, we will consider if there are any rule changes that are needed. It's possible that no rule changes are needed, and instead we might just work towards creating some supervision guidance, because we really like our little guidance documents. Anyways, so we might create a guidance document for the
No, I'm sorry.
So, anyways, that's what MFT is up to. Oh, also, I'm sorry, one more thing that we're up to. We also have noticed, kind of going through our CE process or looking at CEs, that our definition of technology-assisted services is incredibly narrow. It only basically applies to telehealth. And so we are going to be trying to redefine TAS to include more things. So it's including not just telehealth, but, AI or electronic health records, or just all the ways that we might incorporate technology into our work. So that's what we're up to.
Very good. Anybody else?
I will say, and Lisa, you were part of Dr. Merchant was part of this, as well as Robert and Daryl, but we had the ketamine-assisted therapy, I guess that was December 18th. We had a town hall, and there was a pretty large showing, and just a lot of really good insight, kind of back and forth, really just trying to sort of see what the scope of this is, what it looks like in Texas, and how do we regulate this? And so just a lot of really good discussion there. I definitely, recommend. Did we get a recap of that, or is that out for the public at all, or no?
The video?
Yeah,
I have the video, but as you know, I screwed up the Q&A.
Yeah,
and we didn't capture that. So
okay, I was just curious, but I mean, it's definitely not only that ketamine assisted therapy, but other types of psychedelic assisted therapy are coming up, and other emerging practices. Just how AI is affecting the profession, and this stuff is changing literally on a weekly basis. Like the technology and just as an emerging practice too, as in psychology and in all of these boards. It's just such an important and critical thing for us to be thinking about in terms of how this is going to affect our professions and how it's going to affect us as clinicians, as supervisors, from research to really all aspects of the field. So just, but I thought the town hall we had was really informative. It really was a good kind of just feeler. I feel like that it allowed us to sort of see what's actually happening out there. And, as we know, we can't regulate the actual medication itself, but the therapy does fall within the purview of our board. So it just becomes it's going to be an ongoing issue, and we're going to see more of it. So just kind of, I guess, keep your eyes and ears peeled on that as we move forward. But yeah.
Are we going to have another? It's like the little ketamine task force. Are we going to have another meeting or something or follow up?
That's something that we all need to get together and talk about, kind of where we go from here.
Thank you.
As far as the psychology board, though, I mean, I really think most of it we covered today. I mean, we talked about the exam development. We had the task force that where we're looking at the different areas of the exam and just what that might look like and how best to as we develop and think about it. So I'd say those are the main things, but most of it I think we've already covered. Is there anything that I'm missing?
No, the only two things I had was the exam and then ACU.
Yeah.
So I mean,
right.
Thank you for. I had forgotten about the ketamine thing.
Anything else?
Doctor.
Go ahead.
I was going to say, Dr. Taylor, do you have anything for LPC board?
No, I think you covered it well.
Efficient government there.
I would just say a lot of our updates have already been brought up, but we did make some significant committee changes. Like I said, we opened up the number of board members that are eligible to conduct an ISC is now open to all 9. This is kind of in response to we're seeing the numbers of complaints on LPCs go up. And so we are making a proactive effort to do what we can to assist staff with getting those numbers under control. So all 9 of us are now available for ISCs, and we changed basically the mission of the new complaints committee is let's identify trends. What's driving these increases, and what can we do about it? So instead of just being a committee that only does ISCs, they're now looking at a bigger picture, identifying trends, problems, and proposing solutions to keep it under control, because our numbers are kind of outpacing everybody else's.
I love that y'all are being proactive. I love that you're being proactive about that.
Thank you.
And quickly, social work, the national outlook on supervision is trying to figure out how every state, every jurisdiction does something different with supervision. So there's sort of a focus from the ASWB group to look at how can we align to make supervision really work well and look similar across the nation. So that, and then still hoping, looking at and taking information about the compact. So
Very
that's
good.
it.
Very good. Any recommendations for agenda items for the next council meeting? And if you don't have it now, you can obviously submit those later on. Hearing none, I'd ask that we move today our adjournment. I lost a very beautiful friend from childhood to suicide. She served in the Army, a couple tours, leaves behind a beautiful family, and I would ask that we move to adjourn today in honor of all of our veterans who have died of suicide, their families, and the ones that are struggling.
Can I make the motion?
Yes, please.
Yeah, I'll make the motion.
Second. All those in favor signify by saying aye.
Aye.
Thank you, everybody.